we kindly request that all participants, esteemed partners, and embassy representatives to stay with us, please, through the networking dinner. Thank you very much. Your attention.
Collaborative innovation story. Bringing the future now. The 6 pillars of Indonesia health transformation. 1. Primary care transformation. 2. Secondary care transformation. 3. Health system resilience transformation. 4. Health financing transformation. 5. Health talent transformation. 6. Health technology transformation. To achieve systemic health transformation within a relatively short time frame cannot be accomplished by a single party alone. The Ministry of Health cannot act in isolation. Thus, one of our primary objectives is to engage as many stakeholders as possible to join us in this transformative prioritization of health. This is a story about best practices implemented by a collaborative effort of Ministry of Health and Development partners, with the goal of advancing the healthcare for the Indonesian people. Pillar 1. Primary care transformation. Transformation of primary care, widely supported by international development partners, can be better integrated and scale up its impact, enabling Indonesian health to focus more on prevention, rather than responsive curation. Widely chosen by development partners, tuberculosis can be intervened by case finding and community outreach, national policy and guidelines, diagnostic and treatment and integration TB information system to Sehat platform, and provision of diagnostic facilities to all provinces in Indonesia. In the case of malaria, making dreams come true in Tanah Papua, best practices through prevention and early detection and treatment facility, and Minum Obat Masal Malaria campaign in Tanah Papua. Significant support by development partners in this pillar also includes improvement of nutrition status of Indonesian children. These are some of the examples from Pillar 1. Pillar 2. Secondary care transformation. The transformation of secondary care will continue to enhance hospital capacity for treating cancer, heart disease, stroke, uronephrology, KJSU, and maternal and child health, KIA. This pillar support is aimed at improving access and quality of secondary and tertiary service. Many development have committed to construction of state-of-the-art facilities and strengthening capacities of health services in remote areas. Pillar 3. Health System Resilience Transformation. Lessons learned from 3 years of the COVID-19 pandemic emphasize the need to jointly strengthen surveillance capacity for early detection of emerging diseases and to identify increasing trends in disease cases with laboratory confirmation and regions' capacity to prevent, detect and respond to public health threats. Partners have contributed to improving diagnostic accessibility, strengthening early warning system capability, strengthening laboratorium and surveillance, and strengthening local manufacturing health industries. Various partnership schemes providing prominent health reservists during disasters. Pillar 4. Health Financing Transformation. Health financing transformation will continue its efforts to identify and implement a robust and sustainable financing model to achieve universal health coverage, UHC. The best practice in National Health Account (NHA) production with funding assistance from international development partners involves tracking health spending based on disease in the National Health Insurance, Jaminan Kesehatan Nasional (JKN), and strengthening method in policy making. Transforming health financing is a long journey, especially in Indonesia's decentralized system. Let's continue to learn and share to achieve our common goal, universal health coverage. Pillar 5. Health Talent Transformation. Health talent transformation will continue to address the shortage of Indonesian doctors and health workers through innovation in the hospital-based residency program, additional student quotas, domestic and foreign scholarships, ease of equalization of foreign graduates health workers. Pillar 6. Health Technology Transformation. Health technology transformation with the development of a more extensive Kesehatan integration application, digitizing health service facilities, and advancing biotechnology development. Support from our partners have contributed to improve the interoperability of selected information systems, increase data use and support sustainability and resilience. The Kesehatan portal is registered on 34,180 health facilities, which indicates that 25% of the total health facilities in each province of Indonesia are now connected. We would like to extend our heartfelt gratitude for your continuous support and collaboration. Your dedication and commitment have been instrumental in our mutual success. Let's team up to advance the health system transformation.
The essence of what can be achieved through partnership. It is incredible to see how collaborations across different sectors has led to such an impactful innovation for health. Once again, let's give the biggest round of applause to everyone involved in making these incredible strides possible. The biggest round of applause, please, ladies and gentlemen. Thank you very much indeed. His Excellency Bapak Dante Saxono Harbuono, Vice Minister of Health of the Republic of Indonesia. Excellency, the Ambassador of Sweden to Indonesia. Excellency, the Ambassador of India to Indonesia. Honorable Bapak Kunta Wibawa Dasanugraha, Secretary General, Ministry of Health of the Republic of Indonesia. Honorable Ibu Sharifah Liza Munira, the Director General for Health Policy Agency of the Ministry of Health of the Republic of Indonesia. Honorable Bapak Setiaji, Senior Advisor to the Minister on Health Technology of the Ministry of Health of the Republic of Indonesia. Honorable representatives from related ministries and institutions, honorable representatives from foreign embassies throughout the country in Indonesia, and to all of our development and implementing partners present today, we would like to extend our highest appreciations for your presence here, for your endless supports and collaborations for the past years. Distinguished guests, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. May peace be upon us all. Ladies and gentlemen, the Ministry of Health of the Republic of Indonesia warmly welcomes you to the second Indonesia Health Partners Meeting here in Jakarta today on the 26th of June 2024. Today's meeting, ladies and gentlemen, serves to further strengthen and solidify cooperation with development partners in navigating health development agenda. And first order of business, allow me to kindly introduce myself. My name is Rahmat Idris. It is my esteemed honor and privilege to be your master of ceremonies for today's event. And how wonderful it is to see such diverse and vibrant groups gathered here for the meeting today. And throughout the deliberations, you will be hearing from our experts, you'll be participating in engaging discussions, and hopefully leave with new insights and connections. Our goal today is to create an environment where everyone feels welcome and valued. So please don't hesitate to share your thoughts and your ideas. Excellencies, delegates, ladies and gentlemen, to continue unfolding our agenda today, it is my distinct honor to invite a remarks on the insights and the support provided by our development partners towards health transformations and also strategies for health development from 2025 and beyond. It is my honor to invite the remarks from the Vice Minister of Health of the Republic of Indonesia. Ladies and gentlemen, join me in welcoming His Excellency Dante Saxono Harbuono onto the stage.
Thank you. The Ambassador, development partners, distinguished guests, ladies and gentlemen. I'm welcoming you today in Jakarta for the Ministry of Health Second Indonesia Health Partner Meeting 2024. This greeting serves as celebration of our partnerships through the years, helping us to achieve our dream of transforming the Indonesian health systems. We have been working closely together in spirit session, and now at this moment, we can converse, enhance insight, and plan our future step together. We truly value the crucial role our international development partner play in the transforming our health systems. That is why we are determined to establish clear and accountable processes for the grand agreement and other partnerships. I believe that collective effort makes impossible work possible. Our journey begins with the first International Health Partner Meeting in Bali in December 2023, and today we are continuing by sharing with you our story of how our funding and resources have helped us. We are thrilled to present the first partnership report 2024, titled Bridging the Future Now, with showcase story of our collaboration and its impact on advancing health system transformations. During this session, I will also share insight into our achievement together. To begin, I will represent a chart illustration the Ministry of Health Comprehensive Foreign Direct Grants commitments. From 2021 to 2025, the commitment recording by the Ministry of Health Planning Bureau amount to approximately $931.7 million for these periods. This generous grant commitment is allocated across fund, goods, and services. We are honored to recognize the contribution of 30 international donors. We acknowledge that direct foreign grants offer significant advantage as strategic budget sources, providing flexibility in their utilization and bridging the funding gap for Ministry of Health programs. This chart illustrated our utilization of approximately $276.2 million in grant 2023, enabling us to tailor fund to meet specific needs of its programs. Ladies and gentlemen, almost 48% of these dream direct grants, about $131.8 million, supported program implementation, community assistance, medical devices, and management. Reminding the grants we are distributed between service goods with $72.8 million allocated to services for regional technical assistance, consultant, program implementation, training, and even financing, and $71.6 million allocated to goods for drug, vaccine, medical devices, and other essentials. We at the Ministry of Health are deeply grateful for the various support we have received to achieve our health transformation agenda. This included not only support through grant agreement, but also numerous strategy partners who strongly believe in investing in health. We are fortunate to have reliable partners from both government and the private sectors. The joint efforts supported by grant and other resources have shown significant impact addressing gap in national budget. This effort also demonstrates remarkable flexibility and agility, and making them the key enabler and of innovation in Indonesian health ecosystems. We have witnessed remarkable success with pilot subjects in remote area, develop comprehensive hospital master plan to platform our secondary care, provide more opportunity for health professionals to enhance their skill with advanced technology, and made significant strides in vaccine, therapeutic, diagnosis, technology, as well as biotechnology. Esteemed partners, allow me to share some insight from our story. I will begin with the impact of our collaboration. First, on tuberculosis. Indonesia has made significant strides in tuberculosis surveillance. In 2023, we reported over 816,000 new tuberculosis cases, contributing to over 77% of our latest tuberculosis cases estimation of on 1 million. By collaboration with community, by health cadres, and we have screened over 2.2 million tuberculosis high-risk population. Further, Indonesia foster innovation in tuberculosis diagnosis, manufacturing 5 PCR-based TB detection tools, utilization 1,000 PCR laboratories that were distributed across Indonesia during the COVID-19 pandemic, thereby expanding our reach. Indonesia also ensure accessible tuberculosis treatment for all. Indonesia is among the first few countries in Asia to roll out the BPAL and BPAL-M treatment, known as a short-term oral regimen for drug-resistant tuberculosis. Additionally, Indonesia supports the operational research of potential shorter treatment regimen for drug-sensitive tuberculosis. We are one of the first countries in the world that carry out a pilot initiative to incentivize primary care to provide standardized tuberculosis care, including the diagnosis, reporting, and complete treatment of tuberculosis cases. We also engage community to establish tuberculosis army, a trained community of tuberculosis supervisor who help detect and supervise lost follow-up doctor tuberculosis patient. This remarkable progress is made possible through the invaluable support and collaboration of Global Fund, the USAID, and government of the United Arab Emirates and the World Health Organization and the UNICEF in our effort to combat tuberculosis. As for the second collaboration story, we are thankful for the generous support from the government of United Arab Emirates is establishing the Emirate Indonesia Cardiologist Hospital at Solo Technopark. Spanning 17,000 square meters with a building area almost 90,000 square meters, the hospital accommodates 100 beds and incorporates sustainable and green building concept. A significant collaboration has also been established between the National Cardiovascular Center Harapan Kita and Tokusukai Medical Group to build Harapan Kita Tokusukai Cardiovascular Center. This involved construction a 22-story building equipped with the various healthcare facility and supplies. The project including interior design, utility Tokusukai medical health personnel for clinical practice, research, education, and advance in medicines. Finally, for our third and last insight into collaboration story today, I would like to discuss health technology transformations. We achieved a significant milestone by integrating immunization activity and starting detection with WhatsApp. This innovation allows people receive immunization certificate and educational information about immunization immediately after getting vaccinated. We have also integrated WhatsApp with application Sehat Indonesiaku, or called ASICS, the primary application used by health workers in the field. This integration enables the regular detection, monitoring, and recording of stunting case in ASIC database. We recognize the hard work collaboration from WhatsApp, USAID, and UNICEF for making this collaboration possible. Ladies and gentlemen, none of these accomplishments would have been possible without the invaluable contribution of our partner gathered here today. These achievements are not solely the Minister of Health. They are a testament to our collective effort and dedication. This achievement belongs to all of us. However, we should realize that everything is just the beginning. In the next roundtable discussion, I hope we can elaborate on how we leverage our collaboration. We are delighted to hear your aspiration, feedback, vision, and strategy to scale up our impact together. Let's enjoy our session and bringing the future now. Thank you.
Thank you very much, Your Excellency, for the remarks and for your endless determination to transform the national healthcare system throughout the years. We strongly believe you and your team will be able to embrace even more partners in the coming years. Excellencies, delegates, ladies and gentlemen, it is time for something truly magical. We have a special treat for you today, an a cappella performance that promises to be absolutely stunning. This talented group, ladies and gentlemen, is ready to showcase their vocal harmonies and unique sound, bringing you a musical experience unlike any other. Ladies and gentlemen, without further ado, please give a massive round of applause for the amazing a cappella of Inner G.
Good afternoon, ladies and gentlemen. We are Energy A Cappella and we are very proud to be here and to sing for you guys. Is this a real life? Is this just fantasy? Caught in a
you.
For this second song, we might want ladies and gentlemen to dance, kind of dance with us, right?
Yes.
Yes, we want you to dance with us because this is a very danceful song from
Very groovy.
groovy and danceful
This
song.
is song
Yeah.
from MPP.
NTT, yes,
Traditional song. We like to
Invite you
invite
to
you guys,
dance
everybody
with us.
to dance with us.
Let's get off your seats, ladies and gentlemen. Let's all stand up and enjoy in this song. Let's head down. Come on, let's dance. Let's burn out that lunch calories. Join us, ladies and gentlemen. There you go. All right. Woo! Hands up! Hands up! Squat down. Squat down. How low can you go? Woohoo! One more time. To the left. To the left. Woohoo! Thank you so much, guys, for literally bringing over, infusing us with your energy. Amazing, amazing a cappella. Wow. Well, you didn't see that coming, did you? Didn't think you're going to be dancing right after lunch. Thank you so much, everyone, for being great sports. In particular, I'd like to say kudos to our Swedish ambassador there, Mr. Daniel, who has such killer moves with the dancing. Thank you, sir. Thank you, Your Excellency. All right, Excellencies, ladies and gentlemen, let's move on with the next item in our agenda today. We are about to commence the highly anticipated segment of our round table discussions. It is now my pleasure to invite the Indonesian Ministry of Health to lead these sessions. First of all, ladies and gentlemen, we will have a comprehensive presentation by the Secretary General covering critical topics, including the health sector master plan, the donors office initiatives, and grant proposal for 2025. The session will be moderated by the Director General for Health Policy Agency of the Ministry of Health of the Republic of Indonesia. And following this, we will open the floor to our esteemed development partners who have been here today, and each and every partner will be provided time for their responses and insights for approximately 3 minutes. The collaborative dialogue is highly crucial as we aim to align our strategies and efforts for a healthier future. So without further ado, ladies and gentlemen, let's welcome the Director General for Health Policy Agency of the Ministry of Health of the Republic of Indonesia to kick off this important discussion. Let's give a round of applause for Ibu Sharifah Liza Munira. Madam, the floor is yours.
So after such a wonderful performance by everyone here, we move on to the second agenda. Excellencies, distinguished guests, ladies and gentlemen, it's a real pleasure to have you all here at the second International Health Partners meeting, this time in Jakarta. Now this afternoon, we will feature 3 specific topics, which will be on 1, Rencana Induk Bidang Kesehatan, or what we call the Health Sector Master Plan. Second would be on the Donor's Office of the Ministry of Health, and then the grant proposal of 2025. To start, we will have a presentation by our Secretary General of the Ministry of Health of Indonesia on these 3 topics, and we will then open the floor for comments from partners. Now, without further ado, I'd like to invite Bapak Kunta Wibawa Dasa Nugraha, Secretary General for Ministry of Health, the Republic of Indonesia, to deliver his presentation. Pak Sekjen, the floor is yours.
Bismillah. Thank you, Bu Lisa, and good afternoon, colleagues. After we listen an energetic songs, now we start an energetic roundtable discussion, I hope. So, please the presentation, if somebody can start, okay. So I'm honored to welcome you all to this important session. You present today signifies the shared commitment to improving Indonesia's healthcare system, and I extend my heartfelt gratitude to each of you. As we gather here, we face both significant challenges and incredible opportunities. You know that Indonesia health sector is at a pivotal point, and our collective efforts are crucial to achieving our nation's health goals and ultimately realizing the Golden Indonesia 2045 vision. You know that Indonesia, we call it Indonesia Emas 2045. It is our goal and our mission. I hope with my presentation, I will invite you to engage in open dialogue, to share your insights and to collaborate with us as we work towards these ambitious goals. Together, I believe we can create a healthier, more prosperous Indonesia. Let us not differ into how RIPK, like Lisa mentioned, RIPK is a national health master plan, will help Indonesia achieve its grand vision, the role of donor office in the Ministry of Health and grand proposal for 2025. This is our agenda today. So, you know, like now, like I mentioned, that I would like to begin by sharing that Indonesia has an aspiration or vision to be a sovereign, advanced, and sustainable state by 2045. This is our dream. We called it, like I mentioned, is 2045 Golden Indonesia Vision or Indonesia Emas 2045. Indonesia, like you know, will face a once-in-lifetime privilege known as the demographic bonus, which will determine the course of this nation forever. So this is a critical juncture that Indonesia should and will seize effectively. We need to use our demographic bonus effectively to achieve our Golden Indonesia. So to achieve this vision, Indonesia needs transformation in several areas. This includes social transformation as the first and foremost component, with aims to create excellent human resources. Social transformation relies upon health transformation, equitable quality education, and adaptive social protection. So this is our core right now that we need to discuss today. Indonesia has addressed some health challenges. Maybe all of you already know that we focus on its life cycle from pregnant woman to adulthood, even though some problems still remain until now. The main thing is we will be facing challenge that population will be aged in 2050. Also, some health challenges in old generation has also emerged, which has been experienced in developed countries too, such as dementia prevalence and low percentage of healthy old people. So this is our big problem right now, to make people as healthier, so be older and healthier. This is very important for us. And Indonesia is actively tackling perennial basic health problems in its life cycle, such as infant mortality rate, stunting, and TB. That's still our big problem until now. And through the health transformation strategy, we have made significant strides toward health outcomes. In addition to addressing current health challenges, Indonesia needs to anticipate emerging and future health problems in order to achieve Golden Indonesia 2045. So we know in the right column, this is, can be you back to the slide before? The people on the slide before. I just mentioned that in the old people, we see that our population is almost 1/3 of our population is older people, and only 13% of the old people live healthy and normal activities. This is our big challenges in the future. So next slide. Next, yeah. In order to achieve the health vision that for Indonesia Emas 2045, that being stated in we call it RPJPN. Yeah, RPJM is the long planning in 2025 and 2045, and also to overcome some health challenges. Ministry of Health initiated to make National Health Master Plan as the guidance for government and other stakeholders to plan health program more integrated and increase collaborative from each sector. So we composed the RIPK on the master plan, on the National Health Master Plan by 3 approaches, with first is consistency, by considering the future health priorities from health stakeholders. So we are work together through PPOM, is and PKKBN and BPJS is mostly line ministries or that coordinate the health sector in Indonesia. And the second is continuity. We are evaluate the current outcomes and programs. So we need to see our achievement like what. This is still lag behind or already achieved or still need to the process to achieve the output and outcome. And the last is relevancy. So the relevancy is about to see the global best practices benchmarks, determine and validate the health outcome from global healthcare guidance and other countries' benchmark. This is our step to achieve the RIPK in 2025 until 2029. Then the most important thing is consistency, continuity, and relevancy. Next slide. So maybe you still remember our pillar for our health reform. So RIPK has goals, strategic programs, and indicators with focus on basic and new emerging health problems that been identified in the future. These goals and programs may enhance the collaborative process to develop health transformation. We still continue our reform. There are 6 strategic goals that has been created with our health people. It's been in the pillar, the first pillar about the primary services. Our goal is health people, and then healthy lifestyle communities, and the accessible, equal, quality, and affordable health services, strong health system, effective health governance, and advanced health technology. All our outcome will be integrated or will be have the program strategic in the 6th pillar. Like before, primary services is most about the improving our promotive and preventive, and the 2nd pillar about the curative, especially increasing the access for the Indonesian people. And the third pillar about the resilience of our health sector. The fourth pillar, fifth pillar, and sixth pillar is the supporting the first pillar, second pillar, and third pillar. Fourth pillar about the universal health coverage, fifth about the human resources in the health sector, and the sixth is health technology. But our outcome is become in the top about the health people, healthy lifestyle communities, accessible, equal, quality, and affordable health services, strong health system, effective health governance and finance, and at last, advanced health technology. The next slide. I will, next slide. And then the next slide, you can see our indicator based on our outcome, strategic thinking, and it is our indicator. This Ministry of Health has drafted the strategic outcome indicators. It has been discussed and arranged to ensure the triumph of programs that will be implemented by health stakeholders. Overall, we have 36 strategic indicators that are derived from 6 outcomes that should be achieved by Indonesia in collaborative with many institutions. And we already established the donor office to strengthen coordination of foreign loan and grants and strengthening of partnership mechanism. Like you see in the health people and healthy people, we have indicator, something like maternal, we have maternal mortality rate, and for the infant and children, we have under 5 mortality rate, and the adolescent, something like suicide rate, and the senior, we use the WHO indicator, HALET 60. And so on until we have a 36 indicator that we must achieve to get our goal and our mission. The next slide. There are 3 main contributors to ensure the achievement of REPK goals. First is frequent coordination between ministry or institution to ensure the REPK has strategic and in line. So the REPK is coordinate not vertically and horizontally. Vertically is about coordination between our ministry and in government, and vertically is coordination between local government and central government. And ensure the cascading. So the REPK strategic goal, indicators, and program to sub-national government planning document. So we cascade our goal and our indicator to sub-national government or to local government too. And the third is mobilize private sector support. This is to participate actively in REPK program implementation. So we not only for the government, but both on local and central, but also we discuss with the private sector too, that support Indonesia and have the same direction and the same goal and outcome. Next slide. Based on this our thinking, so the REPK or National Health Master Plan, we can accelerate the health transformation goal in Indonesia, Golden 2005 Vision, together with all important partners or stakeholders from central and sub-national government, private sector, and also international support. So right now, we are preparation to have the National Health Master Plan that collaborative all these stakeholders not silo between our government and the local government, even though silo between the line ministries, but also we work together and we have who is the role to achieve our goal to be Indonesian Emas 2045. But here we are concentrated in the health sector. This is our new planning in 2005 until 2025 until 2029. Next, now I want to introduce to you that since early 2024, the Ministry of Health has launched a donor's office, creating a single point of contact for individuals and organizations wishing to donate to healthcare initiatives. Thanks for World Bank to help us to build the donor office. Along with the increasing commitment from donors in providing assistance to health programs, the Ministry of Health is currently undergoing a transformation in the government, both loan and grant, through the donor office. The purpose of the scope of work of this donor office are as follows here. First is to strengthen coordination for planning, implementation, and monitoring of loan and grant projects, to manage a single gateway for loan and grant projects, and to enhance coordination with donors. And scope of work is about grant management, partnership management, and administrative management. And all this donor office we already start since the early 2024. Our structure, next slide. This is the structure of the donor office. We have the following organizations will be directed by Senior Officer of Economic Health and supported by Secretary, Head of Bureau of Planning and Budgeting. So this is under the Secretary General to have a donor office, and we have the steering committee that the member in the steering committee is all the Echelon 1 in the Ministry of Health, and the DGPPR is one of the Echelon 1 in the Ministry of Finance, Bapenas, and Development Partner in there. And we have the technical working group to support the PIU in Ministry of Health. This is our structure, and all the pillars have the PIU. Next slide. The last slide, I think, yeah. I just want to say about the recap of Grant Proposal 2025. There are 13 programs that we are share to you, and you can see and discuss about that. Gitu, ya. I just give some example like human papilloma virus, and this is we try right now with DNA screening for women to have DNA screening. Our target is around 20 million individuals, and the budget around 3.6 trillion, and so on until like neonatal stunting. What is our program until the last is the program about HIV and health workers. This is all the recap of grant proposal in 2025 that we already prepare, and we already in line with our RIPK. So we can discuss about that. All detail of this program, actually I have example maybe in the attachment. Next slide, yeah. Next slide. Next. Yeah, this is our sample about what our proposal for grant that you can discuss. Something like human papilloma virus for DNA screening, our background and urgency, why we need the human papilloma virus for screening DNA. because we know that our cancer cervix is 90% of come from the cervical cancers. So this is important for us to have the immunization for DNA screening. We have the strategy and the target budget and who is the technical unit is. All this proposal that I mentioned before, about 13 proposal, we already have the detail about that. Next slide, something like that, yeah. Not human papilloma, we have neonatal and everything. I didn't want to discuss detail about that, but we can discuss globally about what is the goal, our vision, and what we do in 2025 until 2029. We still continue what we are doing right now, and we have a RIPK and establish the donor office. And we are already prepare the proposal for grant in 2025. Okay, thank you, Bu Lisa. I come back to you.
Thank you very much, Pak Sekjen, for your clear and comprehensive presentation. So let's proceed with the second part of the session. As Pak Kunta explained in his presentation, the Ministry of Health is currently developing our Health Sector Master Plan, or Rencana Induk Bidang Kesehatan, RIBK. This is actually the first time we're sharing this publicly, so we're very excited about this. And as Pak Kunta mentioned, this RIBK will be the main reference for all ministries and all government institutions working on health in Indonesia. This obviously refers to Bappenas's upcoming RPJMN, the 5-year development strategy, but it's more specifically for health with indicators and targets, and that at the national level, all ministries will be referring to this, and vertically as well, that this will be the reference for all local governments in Indonesia to use for their local health plans. Now, we've also identified a number of grant proposals that are in line with this RIBK and Indonesia's health sector strategy for the next 5 years. I believe that now would be a great opportunity for Your Excellencies, distinguished guests from development partners and embassies to share any insights and views you have on these plans. And if there might be any particular interests that have not been covered in the programs featured just now and that you would have as a meeting package. Now, before I open the floor, just some housekeeping notes. One is that in the interest of time, we'd like to ask each response be kept to 3 minutes. And the second would be that we'd like this session to focus on receiving your views and inputs. So if there might be any queries or questions, we can have these discussed later after this event or during the networking dinner. So I'd like to open the floor, and the first on my list are first is the Embassy of Australia by Mrs. Madeline Moss, followed by the Ambassador for Sweden, His Excellency Daniel Blockert. Ibu Madeline.
Thank you very much, Ibu Liza. Selamat siang, Bapak dan Ibu, dan salam sejahtera bagi kita semua. I'd like to acknowledge the Honourable Secretary General, Ibu Liza. I'd like to acknowledge the leadership and the remarks by the Honourable Vice Minister. And Pak Bona and team, thank you very much for the Gemu Fami Re from NTT. It's my favourite song. And it's a health meeting, so it's good to be healthy and get up and move, I think. The presentation on the Health Master Plan, I think, is very well received by everyone in this room. We all want to make sure, as development partners, we are coordinating in line with the Ministry of Health's efforts and the Ministry of Health's leadership. And I'm also very glad to hear about the establishment of a donor office. I feel like development partners, we have a lot to contribute, but I know there are a lot of us, and sometimes coordination is not easy. So we would like to do our part to try to make that effort as easy as possible for your ministry, and I think the donor office is an excellent development. For the Government of Australia, we're very pleased to work with the Ministry of Health in a number of ways. Firstly, on infectious diseases through the Australia-Indonesia Health Security Partnership, focusing on a One Health approach, working on communication and community engagement and surveillance on infectious diseases. And through sharing our experience and expertise, we've been pleased to contribute to Indonesia's rapidly advancing genomics capability through whole-of-genome sequencing. Through our Prospera program, we've been very pleased to have the opportunity to collaborate with the Ministry on developing the master plan and working across the Ministry to strengthen evidence-based policy, project management, and long-term workforce planning. And we're currently in the process of designing our new health program, which we hope will start in January 2025. We'll work on infectious diseases, but also on, generally, primary care transformation, because we recognize that this is a focus for Government of Indonesia. We would like to work more on nutrition and stunting, because we understand that with the introduction of nutritious meals, this will be a big focus for Government of Indonesia, and we want to very much support that effort. I also recall when we were together in Bali in December that Minister Budi spoke very strongly to us development partners about his desire for us to contribute to implementation research and evidence-based policy. And we appreciate that direction and that request. And through our new health initiative in January, we very much want to pick a topic of interest to Indonesia every year and work with you in a collaborative way with an Indonesian and Australian institutions to produce that implementation research. So thank you very much. I think we feel that our work is in line with yours, and we very much look forward to those new priorities in 2025 around nutrition and nutritious meals. And we appreciate our long-standing and close collaboration with the Ministry. Thank you very much.
Thank you, Ibu Madeline. We appreciate your comments and continuous generous support from your government in our health strategy and programs. I would now like to invite His Excellency Daniel Blockert from the Government of Sweden. Your Ambassador, Your Excellency.
Thank you very much, and thank you so much for inviting me here today. It's been a very interesting day, starting out with lunch with the Vice Minister, but hearing about his very healthy lifestyle made me question my own health, so that was perhaps a bad start of this meeting. But thank you so much for inviting us. We are very much committed to collaborating with Indonesia on the health sector. We have as a framework for our cooperation with Indonesia in several areas what we call CISP, the Sweden-Indonesia Sustainability Partnership, where health is one of the sectors that we have prioritized. We are developing an MOU on government to government that will be a framework, but we have already quite a few activities. We have Swedish investors who are sponsoring a PhD scholarship program, and that will start in the Universitas Erlangas in Surabaya, but can hopefully be extended to other universities as well. And then, of course, we have a healthcare development program. As you can see from the slide, we have 5 areas where we see special potential for collaboration, and some of them we are already very active in. Diabetes care, cancer care, critical emergency care, mother and children, and digitalization. On mother and children, I would like to add to what you can see on the slide that we are also working together with UNFPA, who I think is here in the room, on training for midwives. And cancer care, we have one of the sections there is early detection, since there are far too many Indonesians who die in cancer every year because of detecting the disease too late, that we are also looking into early detection schemes for cancer types that are mainly for women, like cervical cancer and breast cancer. We have a number of stakeholders, including several companies that are here today, like AstraZeneca, Getinge, Elekta, Essity, very committed to working here. We work together with not only Indonesian agencies, but also international organizations and several other agencies. And of course, we have what we feel very competitive programs for economic support, export credits, and other kind of financial solutions. Since it's a part of the text that we saw here that I could also present my interest, it would be just to echo what my Australian colleague said, that we very much welcome this master plan. Increased coordination will be very important, not only for your partners, but also within Indonesia. If I had a wish for the incoming government, it would be to continue with the very important reforms that you have already started in the medical sector, reforms that will make it easier for us and others to forge deep partnerships with Indonesia. And of course, that will also require coordination between different ministries here, including the economic ministers, and I'm thinking specifically on trade and economy. But to conclude, we are very much committed to working with you. I think that the master plan is something that will be very helpful in the coming years, and I look forward to continue our cooperation. So thank you very much.
Thank you, Ambassador Blockert, for your structured points on the collaboration and support from the Sweden government. I would now like to invite Ambassador Sandeep Chakravarti from the Government of India, followed by Jeffrey Cohen from USAID. Please, Ambassador.
Thank you very much. At the outset, I would like to say that we are participating in this kind of a forum for the first time. Technically speaking, we are not a development cooperation partner of Indonesia, because India itself is a developing country. But we have seen and we realize that there is a great deal of synergy in our health cooperation as two large democracies, neighbors with similar disease profile and medical health challenges. So we are emerging as a partner in several ways, and in the recent past there has been a large number of exchanges between India and Indonesia in supporting each other. So we are happy to join this meeting, and I think we will be regularly participating in the health partners meeting, because I think it's a great forum to understand the health challenges and its redressal by Indonesia. Masterly presentations by both the Vice Minister and SecGen. I would say that SecGen was in India in May this year, and in his meeting with his counterpart, 5 goals were set. One was to conclude an MOU. The MOU is ready, but we had elections in India, so the health minister changed. So we're going to soon conclude and sign the MOU. They also agreed on hands-on training of Indonesian specialists, supply of pharma products, experience sharing in primary healthcare infrastructure, and telemedicine. I must say that India welcomes the recent change in the law, which allows foreign doctors to practice in health SEZ, and already several Indian hospitals are looking at partnering with Indonesian hospitals to set up advanced medical healthcare facilities in SEZs in Indonesia, and very soon we will have those in place. We are also working with Indonesia to increase the availability of pharmaceutical products, particularly APIs. Ambassador of Sweden mentioned about the incoming administration. Already my teams from the incoming administration have visited India, and they are looking at how we can work with Indonesia to reduce the cost of pharmaceutical products, make them more available to the common people, and also bolster Indonesia's capacity for production of pharmaceuticals and APIs. Even as we speak today, the Director General of Health, personnel, Ibu Arianti Ania, is in India to discuss training programs for Indonesian specialists in the fields of neurology, cardiology, oncology, and pathology. And they are visiting several hospitals across India, and they're also meeting with the National Medical Commission of India to look at regulatory issues. We also want to support and maybe replicate in Indonesia the National Cancer Grid, There is ongoing cooperation between Tata Memorial Hospital and several cancer hospitals in Indonesia. Our proposal is to replicate in a similar fashion what we have achieved in India, where more than 200 hospitals in India are on a national cancer grid to support each other and deploy similar protocols for cancer treatment. So these are some of the goals that we have set ourselves. And once again, thank you for inviting us. And we really want to be one of Indonesia's leading health partners. Thank you.
Thank you, Your Excellency. We look forward to further collaborate with you and seek other potential partnerships that would benefit each of our health systems. I would now like to invite Pak Jeffrey Cohen from USAID, and then followed by the Embassy of the UK.
Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Salam Sejahtera bagi kita semua. Kekuningan naik taksi menuju kantor Kementerian Kesehatan. Bersama kita lakukan transformasi untuk sistem kesehatan yang berkelanjutan.
Luar biasa.
I can never take credit for the pontoons, but I love the pontoon. I think it's a great way that you get your message across in Indonesia in 4 lines or less with active participation, much like the dancing earlier. And I think we all need to learn from Maddie. She clearly's got it down. The U.S. government in Indonesia, starting last November, when President Biden and President Jokowi met in Washington, began the celebration of 75 years of partnership. And for more than 60 years of that 75 years, USAID has been here in Indonesia working on complex health problems in partnership with the government and civil society and the people of Indonesia. For the next 5 years, we will continue to do so. I think that the Health Master Plan focusing on consistency, continuity, and relevancy are key themes. And of course, all 6 of the transformations that the government is seeking are areas where we think USAID can be helpful. We've looked at the 15 grant proposals, and there are many that we think USAID will continue to support in our areas of common interest. And while we're dependent on resources that flow from the U.S. Congress, and they come sometimes very specifically, we know that across the entire health system, we can find ways to be supportive. Over the next 5 years, we anticipate a budget of anywhere from $50 to $60 million per year for about $250 to $300 million in health resources that will go into areas like tuberculosis, maternal and child health, global health security, HIV/AIDS, as well as health system strengthening. And we will be working on a number of new flagship programs over the next 6 months to a year in coordination with the Ministry of Health in all of the stages. Know also that we plan to utilize, as Maddie said, the donor office as a key focal point for all of this coordination. And I can tell you, our experience as development partners in Indonesia, we're very thankful that there is a single point of contact, an office that we can all come together and support as we roll our different programs. Oftentimes we work in silos, and that's not the most efficient way to do so. So we applaud the ministries leaning forward on and standing up a unit that we can work with to be better coordinated. And I'll just briefly announce today, thanks to the work of the World Bank and USAID team, I have signed the multi-donor trust fund, so now we're working together on the health transformation space in coordination and collaboration. The last thing I'll say is, as Atul Gawande, who came to visit Minister Budi last year, and I think developed a beginning of what is a really positive relationship between Minister Budi and Atul, there's a new area that we'd like to emphasize more, that Administrator Power has been working with former President Obama and a host of others, and that's on the issue of lead poisoning. And we really would like to bring partners together over the course of the next few months to talk about the challenges faced in Indonesia in something that can be worked on together and really have positive results across human development when we can work together on cleaning up lead and poisoning issues. And I know that UNICEF is and the World Bank are interested partners in this same space. So we look forward to talking more about lead poisoning as we move towards, I guess, the annual week of awareness around lead poisoning. But thank you so much. Pak Sekjen, Bapak Dante, Bapak Kunta, Ibu Lisa, and the entire health team. I can't tell you enough about how positive the experience is for USAID and all of our partners in country to work with the Ministry of Health. I think it's a model and an area that for the next administration could be reflected in how to better engage with development partners in joint areas of interest to achieve things like the Health Master Plan. Terima kasih.
Thank you, Pak Jeff. Thank you for your statement and announcement. Always appreciate your collaboration, plans, and now your pantuns. So I now invite Ibu Zoe Dayan from the Embassy of the United Kingdom.
Thank you very much, Bapak dan Ibu. Very much appreciate being able to be here. My ambassador sends his apologies. He would have, if he could have. We've just heard, I'm also envied in the embassy for working with a ministry that is planning and consistently setting out what it wants to do and has a structure and an ambition to achieve that. So the master plan is a great approach. We're very supportive and look forward to planning our future work in alignment with that. I also really welcome the donor office. Not an easy job for whoever you place to lead that, but we really welcome that approach. And I'd encourage them not only to look at the large grant proposals, but also to help us coordinate on some of the really important cross-cutting areas like digital transformation, like surveillance, where a number of us, many of us around the table, are all trying to support and make sure that we are in line with you and with one another. So thank you. The UK really looks forward to continuing to support at the level as which we can. I'm afraid we're smaller than some. But we continue to have a focus on surveillance and AMR and that preparedness for events that affect us all globally, the health security. And we are delighted that the Fleming Fund has now been continued for another couple of years. We hope it will continue beyond that as well. The digital transformation we continue to be very supportive of. I think the ministry, in developing its role as supporter and innovator and regulator, is that endless challenge for government of how do you bring it through and keep it safe at the same time. So we're keen to continue to work with you on that. We have some work in workforce development, and the health talent transformation, I think, runs through everything. In particular, we're looking at stroke, working with yourselves directly and with RSPON, with the Ministry for the Primary Care and RSPON for the development of stroke-ready hospitals across the country. The area of technology we are all involved with. I saw the work, the look at HPV screening. Genomics, I think, will continue to be a feature for precision medicine, and the UK looks forward to collaborating. And I hope we've had a proposal to work with yourselves and with BKKBN on midwifery. And I know a number of other players, like in all of this, are also supporting that training, professionalization, in-service continuing development. So we look forward to continuing to work with you and with other partners, and we'll do our best to be aligned. Thank you.
Thank you, Ibu Zoe. Thank you so much for your government's generous support in our planning and execution in the health sector. I would like to now invite the Embassy of Canada, Mr. Kevin Tokar, followed by the Embassy of Netherlands.
Terima kasih, Director General, Secretary General, colleagues. Thank you very much for the presentation today. It's given us a lot to think about. Canada has been a very enthusiastic supporter of sexual and reproductive health and rights around the world. And that continues here in Indonesia, where we've really been focusing our support in terms of supporting the government's priorities in this area. And for us, this comes from a firm belief that sexual and reproductive health and rights are really the foundation for advancing women's rights and gender equality more broadly, and also achieving better health outcomes for all. So it's really good to see that ongoing focus on reducing maternal mortality rates in the presentation. So we've been working very closely with the government of Indonesia to improve access to quality reproductive health services, including family planning, comprehensive sexuality education, adolescent health, gender-based violence, and training. So we've supported the establishment of 10 centers of excellence to support midwifery training, as you mentioned, Zoe, a really important issue. And this has all been supported through our support to the Barani project with UNFPA, UN Women, and UNICEF, which is a 10-year commitment and $20 million commitment to that issue. We've also been working with Nutrition International, doing our part in supporting some of the stunting reduction efforts in the country, supporting micronutrient delivery, food fortification. Also working with UNICEF, strengthening routine immunization and child health. That's a quick snapshot of the work that we're doing. We'd love to talk more with you about how we could work more closely together, and I think the donor office is a really great place to start. Thank you.
Thank you very much, Pak Kevin. Really appreciate the collaboration we have so far and look forward to have further discussions. I would now like to invite Mr. Lucas Rahmidin from the Embassy of the Netherlands.
Thank you. Selamat siang, Mr. Secretary General, Ibu Lisa, Pak Bona. The Netherlands is very keen to continue the different collaboration with Indonesia in the different topics that we have been working closely together. And this include antimicrobial resistance, which also include stewardship training, capacity building on nursing curriculum, as well as biotech training. Thank you.
Thank you, Pak Lucas. I would also like to recognize the written remarks provided by the Embassy of Denmark. And next, I would like to invite partners, starting with JICA, Bapak Okamura, please.
Thank you very much. Selamat siang. Nama saya Okamura dari JICA Jakarta. And Bapak Secretary IBDZ, thank you very much for inviting JICA to be a member of this important development partners meeting. Of course, JICA is doing many collaboration with Ministry of Health, but today I'd like to touch on the several examples of what JICA can do in the future. So I think first topic will be a hospital-based resiliency. You just already explained section, I think. I think anyway, elaborated medical human resource capacity to enhance specialized medical service in Indonesia is one of the prioritized issues. I think in order to contribute this topic, JICA is working with MOH to have a minutes of cooperation between MOH and JICA to accept Indonesian medical specialists to Japan, for example, medium-term training program like 6 months or 9 months, etc. But anyway, by providing this kind of training program, connecting Japanese university hospitals or medical centers to, Indonesian general doctors and MOH, we would like to contribute to medical specialist doctors capacity, further capacity development. I think this is first thing. The second agenda is innovative medicine access. I think we, JICA, is already dispatching one Japanese advisor to the Ministry of Health related to the pharmaceutical and medical devices safety. His TOR is providing supporting technical guidance in pharmaceutical and medical devices. From now on, his main task will be implementing plasma fractionation and stem cell regulation. But anyway, through these kind of topics, we would like to contribute more about medical access, innovative medicine access. In addition to these two topics, we JICA want to contribute to the elderly care. Japan is already facing the elderly society, but in the future, Indonesia will face this kind of same issue. So through dispatching JICA Japanese advisor to the several health politics and MOH, we would like to contribute to the capacity development of health politics. And finally, school meal program. This September, we'd like to invite several officers from MOH and other ministries to show Japanese lunch program at the elementary school and junior high school to show Japanese 100 years experience of a lunch program and knowledge and experience. And through this kind of collaboration, I think lunch program is a very important topic for the next regime. So we JICA also want to contribute this kind of topic. Yes, that's all from JICA. Thank you very much.
Thank you, Pak Okamura. Though many of these programs, ladies and gentlemen, may be known on our list, we realize that there may be some that are yet to be listed by us, so really appreciate you sharing this information, and perhaps it's also a good opportunity for others to see and perhaps see potential joint collaboration across partners here. I would now like to invite from UNICEF, Bapak Mrunal, followed by the Global Fund.
Thank you, Ibu, and thank you, Pa. Allow me to stand on existing protocols in the interest of time. UNICEF is proud and privileged to be partnering with the government of Indonesia over the last 4 decades on multiple aspects of the health program. Specifically in the context of the health transformation, we continue to support the pillars 1, 3, 4, and 6, specifically as mentioned in the plan. The support is through various vertical aspects of the program: health, nutrition, WASH, education, social policy, and social protection, all of which encompass, work together and converge to the protection of the rights of the children in this country. We continue to work in areas which are hard to reach, from Aceh to Papua, as well as in areas where the mortalities are the highest, including the Javas. And we promise to support you in this journey forward to attain the SDGs there. Specifically, we would help the government to work on the routine immunization agenda through strengthening of the vaccine and cold chain management, support the Digital Transformation Office on the various digital innovations and platforms that are being developed for reporting as well as training, continued support to the polio outbreak response to eliminate the menace of the zero-dose children, as well as support in the development of the National Immunization Strategy 2025-2030. We promise to be there along this journey. In the area of the maternal and newborn mortality, we continue to support the development and strengthening of the maternal perinatal death response systems, as well as development of digital job aids for the community health worker. Our work in the health and emergency preparedness is ongoing through capacity building, logistics, supplies, again, digital innovations and nutrition interventions. We're very happy to partner on the adolescent health agenda, specifically on the mental health agenda, the substance abuse, including tobacco cessation and prevention, as well as immunization, including the HPV vaccination for adolescent girls. Partnering with the government in Eastern Indonesia on the elimination of malaria is one of our key activities, as improving the management of the childhood TB and decreasing the incidence of childhood pneumonia and diarrhea. We continue to work on the lead poisoning agenda, taking the work we have done in Tegal and Bogor to scale under your leadership. We support the effort of the birth registration at health facilities so that we can establish good denominators, solid denominators for future program planning. In the area of nutrition, we continue the development of and supporting the development of the national guidelines multiple training modules for managers, for Poshandu cadre, for frontline health workers and managers, so that we have a much better empowered workforce to deliver good nutrition services. Specifically, we are helping with the transition from the iron folic acid supplementation to the multiple micronutrient supplementation program in the antenatal space. We continue to support the ending open defecation agenda, enabling climate resilience wash services in Poskesmas, and the implementation of WashFit in Poskesmas. We also work closely with the Ministry of Finance on the budget credibility exercises for immunization program, including budget tracking exercises for the health immunization. To summarize, our multifaceted support aims to strengthen Indonesia's health system in the area of decentralization, ensuring that local governments and health centers are well equipped to deliver high quality health services and reducing the disparities. UNICEF will continue to support this work and looks forward to close collaboration. Thank you.
Thank you very much, Bapak Merunal. I would now like to invite the Global Fund, Bapak Nicholas Farsi, who is joining us online. Over to you, Pak Nicholas. Yes, please, Pak Nicholas, over to you. Can you hear us? The sound isn't. We can't hear you yet, Pak Nicholas. Next slide. Telepon.
Okay. There is a
pakai speaker aja.
technical glitch. Yeah. You can speak on the microphone. Yeah.
Okay, we'll put you on speaker, Pak. Yeah, go ahead, Pak Nicholas.
Okay. Thank you very much, Ibu Liza. Can you hear me?
Nggak bisa.
Very well, Pak.
Okay. Sorry about that. Can I go ahead? Okay. So, selamat sore, everyone. Sorry I can't be with you today in Jakarta, but I can follow all the events very well. So, thank you for the organization of the event, and let me already join my colleagues previously to share with you, Pak Sekjen, Ibu Liza, our positivities to work with the Ministry of Health of Indonesia. And I think that this event is another evidence of it, regarding all the efforts that you are making to coordinate and align the various development partners to follow and align with the vision of the Ministry of Health of Indonesia. So the Global Fund is currently investing around $100 million a year in the fight against tuberculosis, HIV, and malaria. And I was pleased to hear Vice Minister Pak Dante previously highlighting the very good results of the Ministry of Health together with the partners in the field of TB especially, and the high increase of notification. But the Global Fund is also investing increasingly in health system strengthening in the various pillars that were also highlighted in the master plan. Pandemic prevention and preparedness, health project management, human resources for health, and so on and so forth. From this perspective, the master plan that was presented is a great opportunity for the Global Fund to align to the strategic direction of the Ministry of Health and to be at the disposal of the Ministry to invest fresh and flexible money in the direction that the Ministry wants to follow. It's not only an opportunity to align programmatically speaking, but also, I think, from a financial perspective. With the appropriate level of assurance that the government of Indonesia can provide to the efficient use of the funds, it's an opportunity to switch progressively from input-based financing to output-based financing, which will ease the work of the Ministry of Health and the partners to coordinate the funds from various sources and focusing on the results that we collectively want to achieve. Last but not least, I would like to emphasize also the importance to continue to invest together with our partner from the civil society organization and community-based organization, which also play a major part in the achievement of the results highlighted in the master plan. Should it be in the field of tuberculosis for active case findings or follow-up of patients, or in the field of HIV, also amongst the so-called key population to detect HIV, but to also follow up on treatment. The necessity to establish appropriate mechanism of social contracting and give the opportunity of those organizations to receive some funds from the government of Indonesia is also an important part to reach the results that we want to achieve, and especially in the field of tuberculosis and HIV. So thanks again, Ibu-Lisa, for this opportunity to be with you, and the Global Fund as a multilateral agency is looking forward to continue our cooperation. Thank you very much.
Thank you, Bapak Nicholas, and the Global Fund for your much support on AIDS, TB, malaria, and health system strengthening. I would like to recognize the written remarks provided by Gavi, and now would like to invite from the UNDP, Bapak Norimasa Shimomura, then followed by WHO.
Thank you very much. Good afternoon, everyone. Particularly, thank you very much, Ministry of Health, Sekjen, Ibu-Lisa, for convening this meeting of partnership. I think by far I can say this is a best practice of donor coordination, partnership coordination. So congratulations, and thank you very much for convening us. UNDP has been a very humble and also a grateful partner, implementing partner of Health Ministry. Particularly in the recent years, we were very happy to have worked with the Minister of Health in developing the blueprint on digital transformation in the health sector. And side by side, we have developed the SMILE, the SMILE application that you have used in distributing the COVID vaccines, 400 million doses of them across the country. And now you have actually improvised the SMILE application to be used for managing the logistics of routine vaccines. So 400 million doses more of routine vaccines have now been also registered and used through this application. And this application is now being used to manage health commodity logistics across the country. And I think we were smart enough to turn this around and use the same application to manage medical waste management as well. And recently, a decision has been made by your ministry to scale up this use of waste management module of the SMILE application in all state hospitals in the 37 provinces. So this is a great development, and I look forward to the ministerial decree that would formalize the status of the One Health logistics that includes SMILE very soon. And building on this partnership, we have also gone through the journey of your ministry's efforts to develop precision medicine to predict and prevent future diseases through the establishment of the network of the genome sequencing laboratory around the country. So we're very happy to have equipped or in the process of equipping the 10 top-of-the-line whole genome sequencing laboratories in this country, along with 18 other genome sequencing laboratories around the country. So that makes the total of the laboratories to 39 across 29 across the countries. So this is quite an advanced effort, and we have also deployed the experts in some of these laboratories and work hand in hand with WHO to support you craft the strategy to manage this well in the future. All of these have been made possible, of course, with the trust from the Ministry of Health, but with our partnership with the Global Fund, Gavi, Government of Japan, Government of Australia. And so we look forward to increased partnership with this. And case in point, we are starting to work with Green Climate Fund together with WHO to look at the implication of the climate change on the health sector. So we would be gearing up on this and hopefully be able to address some of your priorities that you have kindly outlined in the Health Master Plan. Thank you very much.
Thank you, Bapak Norimasa, and thank you, UNDP, for your long-standing support and collaboration with our government. I'd now like to invite Ibu Mamo Takeuchi from WHO.
Thank you so much, Ibu Lisa, Pak Excellence Section, Pak Pona, and colleagues. I'd like to echo my colleague Nori for congratulating and thanking for convening the health partnership. So as a WHO, we are very happy to say we are deeply committed to our partnership and fully aligned with the health transformation agenda throughout our next 5-year priority. For Pillar 1 and 2, we support Indonesia's journey towards full realization of universal health coverage. Also, that includes the quality of services, patient safety, both at primary and secondary levels. We also support strengthening of governance of capacity building for the governance, standard setting, policy development for the health system to better prevent and prepare for and respond to both acute and chronic illness and conditions, and of course to promote healthy lifestyle. For Pillar 3, we acknowledge government efforts to strengthen local production of pharmaceuticals and health technology towards self-sufficiency and global competitiveness. So we continue working with the ministry to improve supply chain in a holistic manner, for example, implementing reliable forecasting methods, institutionalized fair pricing, among others. We also support overall national capacity to prevent, detect, and respond to all kinds of health emergencies. As for Pillar 4, we continue to support the government in improving revenue raising, fund pooling, and strategic purchasing and public financial management. We are really committed to further strengthen MOH capacity to analyze health expenditure data and make informed financial decisions. As for Pillar 5, our collaboration on health workforce focusing on improving production, distribution, and quality. This includes faculty development across 38 MOH polytechnic, strategic health workshop planning, operationalization of national HRH information system, and design and implementation of training program and learning modules, and of course, development of the Pelataran Sehat roadmap. Finally, for Pillar 6, our partnership covers capacity building in the area of national regulatory system, research governance, and knowledge management. We are committed to improve data quality, standardization, data analysis, utilization, and CRVS. We work with the government and partners toward a robust data-driven health system that serves as the foundation of effective digitalization in the health sector. Please rest assured, and we look forward to our continued collaboration with you and all the partners here today. Terima kasih.
Thank you, Ibu Mamo. We also thank WHO for your leadership in the health sector. We'd like to now invite UNFPA, Bapak Hasan Mohtashami.
Terima kasih, selamat sore. Thank you so very much, Bapak Kunta, Ibu Liza. Thank you. Appreciate senior government officials in the Ministry of Health. Very well established, well organized partners meeting. I congratulate you. Echo my colleagues as well, congratulating you on both the well-crafted, well-elaborated strategic plan, as well as establishing the donor's office, which is quite a welcome development on our side as well. We were talking with Ibu Liza, if we work with 3 different DGs, now it will be much more coordinated to work with one consolidated office in the Ministry of Health. Appreciate that. UNFPA is Sexual and Reproductive Health Agency of the United Nations, so we focus on areas related to sexual and reproductive health. I'm very happy to see the maternal mortality ratio as one of the highlights of the outcome indicators in your strategic plan, and as a result, all our efforts is focusing on reduction of maternal mortality in Indonesia. The 3 major interventions, 2 of them are with the Ministry of Health. The first one is family planning. We are working with the BKKBN, but with the other 2, midwifery and emergency obstetric care, is our collaboration with the Ministry of Health. We will be focusing on midwifery. As a result, in your proposal, the last on the agenda, on the very last slide, human resources, we will focus on that, working with DG on human resources with health. We will focus on midwifery education. We all know that there is quite a good number of midwives, over 400,000 midwives in the country, over 1,000 midwifery programs in different institutions, and yet maternal mortality is high. That indicates simply the quality and the quality. We need to focus on the quality of midwifery education, and as a result, what we will be doing with support from other partners that we are receiving, Canada and UK and Sweden, we hope to make sure that we address midwifery in a comprehensive manner, addressing pre-service training, standardization of the curriculum and education. Midwifery is not a practice to learn in the classrooms. We need to make sure that it's practical. Then in-service, professional continuing education and training programs, and of course regulatory accreditation and other policy frameworks around midwifery. So these 3 will be the main focus of our program in supporting your proposal. Of course, we are doing other activities beyond that proposal as well: emergency obstetric care, linkages with the private sector, and of course our work with the Ministry of Finance, Ministry of BKKBN, and others on bonus demography. I heard it was the first word SG mentioned when he started his points. Bonus demography is something that we need to look into that for Indonesia, because it will be quite a couple of decades. Indonesia will have the blessing of having a very sizable workforce, but it requires macroeconomy, fiscal policies, human resources, social policies, and we work with the Ministry of Finance, BPS, BKKBN, and BAPENAS particularly on this issue. We hope that we can also engage Ministry of Health in that discussion, particularly on the national transfer account, which actually basically is talking about all the age groups care that are needed, including elderly care, which is part of the national transfer accounts. We do also engage with the Ministry of Health on gender-based violence, medical care for survivors of gender-based violence, and we have worked in the past, we continue to do that, and also data. We are the population data agency, so we hope to expand our work together with BPS, together with the Ministry of Health, in ensuring in-depth analysis of all these databases that we have, including the National Health Survey that you just concluded. Thank you so very much. Terima kasih banyak, and thanks for the opportunity.
Thank you, Pak Hassan. The points you've highlighted are well noted, and we'd like to thank you and FPA for your support and collaboration. Pak Hassan shared with me over lunch that you have 3 collaborations with 3 different DGs, and I expressed to Pak Hassan, you'll have to wait for the presentation that Pak Sekjen will give, which will be the answer, hopefully, to this issue. So we're very happy to be able to share a timely and concrete response with the donor office, Pak Sekjen. I'd now like to invite from the World Bank, Ibu Chut Novianti, and then followed by USTDA and then KOICA. Over to you, Ibu Chut.
Thank you, Ibu. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, Ibu dan Bapak. The World Bank is very privileged to be supporting the government of Indonesia in your reform agenda for Indonesia health sector through our range of analytics and operations. Of course, in parallel, the World Bank has endeavored on strengthening collaboration and cooperation with other development partners through co-financing of our operation, and also through multi-donor trust funds to further coordinate, enhance, and catalyze improvements in health in Indonesia. Our own support of about $5 billion has been supported by another $3.5 in co-financing contributed by our partners. So the government's reform agenda reflected in your 6 pillars of the health transformation agenda are fully in line with the recommendations from the comprehensive analytical knowledge based on supply side readiness provided by previous World Bank works, and we are honored to be supporting in all of these 6 pillars. So we have supported the health transformation agenda and will continue support through our Indonesia Supporting Primary Healthcare Reform, our ISVIR program, which aims at achieving results across primary care governance, quality, and information systems. We have the COVID-19 emergency response, which supported pandemic response and vaccination rollout jointly with AAIB and KFW and Australia. We have our JKN reform and results. We have the Investing in Nutrition and Early Years, or known as INE, both phase 1 and 2, which improve coordination and funding flow across sectors and levels of government, and support improvement in quality and coverage of services to reduce stunting, jointly with GFF, Gavi, Gates, and Tanoto Foundation. Our health system strengthening work, which strengthens supply side readiness across the country's health sector, jointly with AIIB, SDB, and ADB. And last but not least, we have the Indonesia Universal Healthcare Development Policy Loan, which is centered around major policy reforms in HRH, and our program to strengthen the national TB response, jointly with the Global Fund. So this health transformation agenda will further be supported by our multi-donor trust fund with Australia Gates Foundation and USAID that aims to further catalyze improvements in the Indonesian health systems and ensure coordinated development partner support to the Ministry of Health. And together, these efforts aim to achieve impact across a wide range of critical health sector reform that will help achieve better health outcomes for everyone in Indonesia. Thank you, Ibu. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Ibu Chut, and thank you, the World Bank, for all your support and collaboration. I would now like to invite USTDA, Ibu Hana.
Thank you, Ibu. Selamat siang, everyone. I humbly represent U.S. Trade and Development Agency. U.S. Trade and Development Agency, we operate in 50 countries globally, including 20 countries in Indo-Pacific region. We connect America private sector to priority healthcare infrastructure project. We basically focus on preparation of health infrastructure project. USTDA achieved its mission by funding, firstly, feasibility studies, secondly, technical assistance, and thirdly, pilot project or proof of concept that integrate the innovation and advanced expertise of U.S. companies. Provide reverse trade mission or study tour to the U.S. on particular topics that Ministry of Health and colleagues want to learn, want to explore more. And we also have organized expert workshop and industry conferences. Basically, we don't have allocated funding for the next year. It is really bottom-up project proposal grant submitted to us. For example, last year we have received and support this National Image Data Repository project proposal from our US companies, GE Healthcare, and in cooperation with Pusdatin, Ibu Tiomi Maida, and DTO, Bapak Setiaji, to conduct this proof of concept of this National Image Data Repository. So we are happy to support you, Ibu, and all Ministry of Health colleagues for the next year master plan for healthcare. And I particularly identify these two possible cooperation on the secondary services to increase hospital network, integrated competence-based referral system, high-quality standard services, and enhanced 10 priority disease services, as well as the last box, advanced health technology, especially in strengthen national health emergency response, and that sort of topic. Thank you very much for the kind attention.
Thank you, Ibu Hana, and thank you, USTDA. I would now like to invite Bapak Jong Yunjul from KOICA, and then followed by Nutrition International. Bapak Jong Yunjul, over to you.
Thank you very much. I'm very pleased to attend the Indonesia Health Partnership meeting today to share with you the KOICA's programs and directions in health sector in Indonesia. KOICA is an implementing agency of grant assistance of Korea government, and is a long-standing partner of Indonesia government and people. I'm so proud of the fact that KOICA has made a remarkable contribution to social and economic development of Indonesia by providing numbers of KOICA assistance program for last 32 years. KOICA has worked in Indonesia more than 30 decades, but KOICA started the health project in Indonesia only in recent years. Health sector has been duly added in KOICA's country partnership program in 2021. Health issue has emerged as the main cooperation area in Indonesia since then. Through cross consultation between KOICA and MOH from 2022, KOICA has provided a total of $25 million for projects so far. So I want to introduce briefly about the project. The first one is the project for the promoting disaster management capacity in health system in Mataram, Lombok. And second project is the consulting project on establishment of Indonesian health worker management system. And third one is the project for the maternal and child health care in Papua region. This program is the collaboration with the UNICEF. And the fourth project is the invitational training program for tuberculosis management. And KOICA will invite 15 the MOH officials to Korea for 2 weeks in 2 years. KOICA has strong commitment to support health sector in Indonesia, and that will contribute to the health development of Indonesia. Even though KOICA's budget is limited, KOICA wants to support in such area that Korea has comparative advantage, and the Indonesia government faces challenges. One of the KOICA's interest for future cooperation in health sector is tuberculosis management. Of course, other areas are all opened. So, KOICA want to arrange this meeting with the MOH, and donor office is established recently, I understand, and to discuss the direction of cooperation in health sector soon. Thank you very much for your attention.
Thank you, Pak Jong, and thank you, Korean government, for all your support, and we look forward to collaborate further with you. I would now like to invite Bapak Heriu Hatu from Nutrition International.
Terima kasih, Ibu Lisa. Selamat sore. So Nutrition International, we are working in Indonesia since 2006, and now we are covering 6 provinces in Indonesia. We are focused on nutrition, making sure that people we are served, they have no issue with accessibility to the macronutrient. In terms of the age group, we are covering different age group. We are starting with the under 5s, the newborn, pregnant woman, adolescent, as well as the general population. For the under 5s, we are more focused on vitamin A supplementation, but we are not providing the tablet or the capsule of vitamin A. What we do is more on providing the technical assistance to the health provider, making sure there's no stock out in the puskesmas or in the other different level. So what we do is that more on the training on the supply chain. That's something that we do as well for the other nutrition commodities, like a weekly iron folic acid for adolescent and pregnant women, as well as for the zinc ORS. For all the nutrition commodities, we do that supply chain management training or capacity building. So in terms of what the approach that we do is that we can say that we do some intervention on supplementation. And we also do some research and evidence-based generations. One example of it is that we do kind of like research of cost and benefit analysis, and making sure that we know with this investment and how much return that we will gain in the future. And for the general population, we do as well some intervention on the food fortification. Currently, we mainly focus on the food fortification for salt iodization and wheat flour fortification. But we are thinking as well of expanding to the other commodities, which is the rice fortification and edible oil. And in terms of nutrition, we also provide some education to adolescents, to the general population, a pregnant woman, and the community we serve. We provide as well some technical assistance. We are making sure that the government and the environment that we serve, there is like a good nutrition governance. So that's why then in some provinces and subnational level, we also provide some technical assistance to the government, making sure that they have alignment in terms of the regulation with what comes out from the national level. So we do some alignment on the regulation at the subnational level, working with the local government for sure. And now we are in the process of finalizing or developing our next 5 years program globally, but as well as for every individual countries of NI, which is including Indonesia. So I think this is like a good moment as well for NI and the MOH that we can sit together and see how then we can work together for the next 5 years. Thank you very much.
Thank you, Bapak Heriu and Nutrition International. I would now like to invite Gain and invite Ibu Widya to give her statement.
Thank you, Ibu Lisa. I have a short presentation just to help us get the discussion. Okay, if it's not ready, that's fine. So GAIN is actually has been in Indonesia since 2012, and we are a Swiss-based foundation that focuses on addressing malnutrition all over the world. GAIN operates in 12 countries, including Indonesia, and if Indonesian government has the Health for All ambition, GAIN ambition is to have healthy diets for all. Unfortunately, the presentation is not ready, but I was going to show you the cost of adequate diet or healthy diets for Indonesian, and just a takeaway from that is that 71% of Indonesians has food budget below the cost of healthy diets. So the majority of Indonesians cannot afford healthy diets. In terms of the discussion today on transforming the health systems, we would like the government in Indonesia to also promote healthier diets, and these can be done through 9 areas. There are nutrition education and awareness, agriculture and food systems, food policy and regulation, access to healthy foods, and health services integration. We also would like the government to support local initiative that has been initiated by community and improve on research and data collection to ensure the effectiveness of the government programs to ensure that nutritious and safe food are accessible for all. We also encourage public-private partnership as well as addressing socio-economic factors. Let me also share with you what GAIN has been doing in the past and currently. So GAIN has been working closely with the Indonesian government to conduct policy support for the food transformation system roadmap as well as the food loss and waste roadmap. We also are working on fortification for rice as well as salt. And we also have developed with collaboration with Bapanas, a food system dashboard that covers 24 provinces with 78 indicators. Hopefully the dashboard can be used to actually provide information for policymakers on food system transformation and also how to promote healthy diets for all. We also have a program on educating the adolescents to improve nutrition literacy for youth through gamification. We also have conducted a pilot on demand generation that is going to be conducted through Food Culture Alliance as well as market-based intervention. This year we will start to work on the connection between environment and nutrition by identifying priority foods that is rich in nutrients but also have low environmental impact. And then upcoming programs for GAIN, just to share a little bit, will be focusing on workforce nutrition as well as nutrition-sensitive social protection. So those are the things that I can share with you today, and GAIN is very open to collaboration, particularly with the Ministry of Health. We have really good relations with the Directorate for Gizi and Kia. So thank you very much, Ibu Lisa.
Thank you, Ibu Widya, and also thank you, GAIN. I would now like to invite Bapak Trihono from Thinkwell Institute, and then followed by Chai. Please, Pak Trihono.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Pak Kunta, Bu Lisa, dan Pak Puna, thank you very much. Thinkwell Institute will continue our support to the 6 pillars of transformations, mainly for the 3 pillars. The first pillar for the primary care transformation, and then the 4th pillar for health financing transformation, and then for digital technology. For the first pillar for the primary care transformation, I think well as a coordinator of a primary healthcare consortium will support all activity of the primary healthcare consortium, mainly the management of field laboratory of the IHPM implementation in 4 districts, in collaboration with 4 universities, University of Indonesia, University of Gadjah Mada, University of Pajajaran, and also University of Udayana. And now we are with the coordination of DG Cosmas, we are formulating the ILP service model, and based on that we want to calculate about, to estimate the budget needed if the ILP will be implemented in all of the villages in Indonesia. And Based on that, we can also calculate what the budget impact analysis if we want to implement it in line with the local situation like this. For the last pillar, for the digitalization, we will involve in the telemedicine, especially in the industrial sandbox. Thank you, Bu Lisa.
Thank you, Pak Trihono. It's very interesting, and we appreciate that a number of your messages have been formed towards our 6 pillars. So I think it's a very structured way for us to all work together. Moving forward, I'd like to invite Ibu Atik from the Clinton Health Access Initiative. Silakan, Ibu Atik.
Selamat siang, Pak Sekjen, Bu Lisa, dan Bapak Ibu semua. First of all, I would like to say thank you for this opportunity to participate in this important discussion. As a CHAI, we work alongside with the Ministry of Health in its transformation agenda to achieve the government vision of Golden Indonesia 2045, especially for the primary care transformation and also the health technology transformation. So, CHAI committed to supporting the Ministry of Health priority program under our existing MOU, which is continuing support under our focus on the prevention, especially with immunization, how we can reduce zero-dose children until 25% by next year, and also improving coverage a new vaccine, especially the life-threatening vaccine for children, which is pneumococcus conjugate vaccine, rotavirus vaccine, and also for school-aged children, which is human papilloma virus. So ensuring that every child receives life-saving vaccine. And also, we strengthening primary health center through the MNCH, especially working together with the private sector, strengthening the supply chain management and also digital transformation in the primary health center area. And also, the third one, focus on the assistive technology for people with disability, which is the early screening and also development delay for children under 6, and also providing appropriate assistive technology and play therapy for them, ensuring timely intervention for optimal development. So in conclusion, CHAI is dedicated to transforming Indonesia health system through strong collaboration with the Ministry of Health and also with other partners, of course. And together we can achieve our shared goal of improving health and quality of life for the people of Indonesia. Thank you very much, Ibu and everyone.
Thank you, Ibu Atik. Thank you, CHAI. I would now like to invite Bapak Joseph Azim from Médecins Sans Frontières, or MSF.
Selamat sore. Thank you very much for inviting MSF. Thanks a lot. MSF also prepared a very short presentation. I don't know if this can be displayed here. If not, I can continue. Just to give a brief introduction of Médecins Sans Frontières, that MSF is an international medical aid organization, and we provide medical assistance in the areas where there is disaster, whether it is natural or man-made disaster, and we provide clinical assistance, medical care. Globally, our team consists of 68,000 employees altogether, which consist of health professionals, logisticians, and so on. Our core values are independency, neutrality, impartiality, and this is what we work on the values. Could you please move to the next slide? Next slide, please. Next. Thank you. MSF has been present in Indonesia since 1995, and since then we have been providing assistance and support to Ministry of Health in various disasters in the form of medical care, especially in the time of tsunami in Aceh 2004. MSF disengaged in 2009 and re-entered the country Since then, in 2017, and since then we have been providing medical care in various natural disasters. And also we had adolescent healthcare project in Banten province that was for 5 years, which was closed down in 2022, and MSF started providing capacity building support to Ministry of Health in the area of emergency preparedness and response to health crisis. Next slide, please. Just to show here that the areas, the provinces on the map of Indonesia, which are designated by the Ministry of Health, which are prone to natural disasters, and also to show our operations in the area of Aceh, Banten, Sulawesi, and Maluku, where our capacity building programs are going to happen. Next slide, please. MSF has direct collaboration with the Health Crisis Center of Ministry of Health through a memorandum of understanding, and the duration of its this MOU is from 2024 to 2026. The main two activities of our MOU with Ministry of Health is to provide capacity building services for the emergency prepared response to health crisis, as well as supporting the Ministry of Health and local authorities in the time of disaster through direct response in emergencies. Our budget to implement the MOU for the 3 years is equivalent to 1.9 million euros. And we also partner with local organizations such as PMI, IDI, MDMC, provincial and district health office. The capacity building program is known as eHub, and it covers 4 domains of trainings that we provide. That is medical emergencies, mental health, environmental health in emergency, basic geographic information system, data management, and the logistic and supply for the management of the warehouses, which is the 5th domain, and it is under process for the preparation. Apart from these the standard trainings that we provide in these 4 domains, we are also working to prepare the crash courses or flash courses to be given in the time of emergency response, and the digital courses to be available for the broader audience as a self-learning, as well as training of trainers so that people, the healthcare responders, can replicate the training program throughout the Indonesia. Just to give you a snapshot of our activities, our achievements till now, we have been given trainings in Banten province, and till November 23, where we had 466 participants, and the pre-test scoring was in average 57%, where you can see 77% post-test scoring. Just to mention that our capacity building program is in relation with the 3rd pillar of the health transformation in Indonesia. And we assure that our support carry on with to the Ministry of Health. Right now, after Banten in 23, our teams are providing capacity building programs covering these 4 domains in the province of Aceh as we speak. That's all for now. Thank you very much again for having us here. Thanks a lot.
Thank you, Bapak Joseph, MSF. I'd like to now invite Bapak Fatih Turkmen from the Islamic Development Bank, and then followed by WFP.
Bismillahirrahmanirrahim. Dear Pakunta, Ibu Lisa, and colleagues from MOH, on behalf of Islamic Development Bank, I would like to thank you for organizing this health sector partners meeting for the second time, which is transforming into an important forum whereby we can share all experiences and we can learn from each other. Let me try to elaborate on our presence in Indonesia. So I am proud to note that for Indonesia in the healthcare sector, in less than 5 years, we were able to develop a $1.5 billion portfolio, which is composed of 3 big health projects. The first project is focused on strengthening the 6 leading national referral hospitals of Indonesia, particularly for the mother and child hospitals, including Darmais, Persahabatan, and other referral hospitals. So we started this project. This is a $300 million project in 21. And as we speak, all the constructions are 90% is about to be completed, and we are providing the medical equipment for the hospitals. In less than 2 years, as we are recommended and guided by the Minister Pabudi, we are targeting to complete these hospitals. When we are completing this, it will mean that the access to better quality health services in tertiary level will be improved for 40% of the Indonesian population. In other terms, we will be providing better access to 110 million Indonesian populations, particularly women and child care. As we know, infant and maternal mortality rate for Indonesia is unfortunately still high, and it's a challenge. The second project is including improving the oncology infrastructure for another 6 leading referral hospitals for Indonesia. And we have approved this project as of last year, and we started the civil works already. When the project is completed, we are planning to improve the oncology access to 25% of the Indonesian population. So this project, which is 200 million euro, targets to improve the access oncology treatment. As we know, the incidence of oncology is around 1 million. Every year, 400,000 additional cancer cases are noted in Indonesia, and the annual death rate is around 235,000. So the current access to oncology services is very limited. That's why, as per the guidance of the ministry, as per the strategic plan and priorities of the ministry, our second project is trying to this important intervention. Last but not the least, as already been mentioned by our World Bank colleagues, in December 23, 4 leading multilateral development banks, we have signed together the biggest health intervention to date. So it is a 4 billion health sector strengthening project. Under this project, ISTB is financing, extending $850 million for improving provision of oncology medical equipment for 600 hospitals. We have all together started working as one team, and we have initiated the procurement process. This project will improve the universal health coverage and is targeting to provide essential health equipment for primary public laboratories and hospitals. So it will be a giant leap for achieving the universal health coverage for Indonesia. That's what we have been doing together with our ministry in the health domain. Secondly, I would like to elaborate on the master plan, which is very innovative also. One issue that I have to mention is, as we all know, health inequality is a determinant of lifetime inequalities. So it is encompassing health for all and a universal health coverage. But when we look at the health statistics, as also expressed by Pakunta during his presentation, for example, the number of hospital visits is significantly less than when compared with OECD averages. And the infant maternal mortality rates death rates are high. Anemia, tuberculosis, stunting and wasting are still prevalent. So this shows us that the health inequality is an important dimension in the overall health framework. So in the master plan, this can be emphasized more, and maybe using the already available indices or coming up with a new indices, which is showing the performance in terms of improving the health equity can be very aligned with the Indonesia vision also. Thank you very much.
Okay. Thank you, Pak Fatih and Islamic Development Bank. I'd now like to invite from the World Food Program, Ibu Jennifer Rosenzweig.
Terima kasih banyak dan selamat sore ibu-ibu dan bapak-bapak, dan terima kasih banyak untuk Ibu Dirjen dan Bapak Sekjen. Thank you very much to the Ministry of Health today for welcoming us as partners here for this critical conversation. WFP as a UN agency is committed to supporting and working in partnership with the government of Indonesia to achieve its SDG targets with a specific focus on SDG 2. WFP recognizes the importance and the success of the master plan and highly appreciates the commitment of the Ministry of Health with its donor coordination platform as a means for better collaboration and partnership. WFP works in partnership across multiple sectors, inclusive, of course, of the health sector. And through technical assistance and knowledge exchange, WFP aims to support the government in its efforts to increase the availability, accessibility, affordability, and consumption of a safe and nutritious diet. We look forward for the rest of this year, as well as in the coming 5 years, towards continuing our collaboration on this important area of work. From the perspective of the health sector and our partnership with the Ministry of Health, this includes supporting digital innovation through the GERMAS program with a focus on innovative SBCC methodologies to improve the demand for nutritious foods among adolescents. We also work through a cross-sector approach for the scale-up of affordable fortified rice, done in collaboration with the government through the large-scale food fortification platform. In our cross-sector approach, WFP also looks forward to continuing to work with the government of Indonesia towards ensuring access to safe and nutritious foods through school-based platforms. And we'll continue in our approach to support and facilitate knowledge and learning exchanges. I would like to acknowledge the remarks from India and JICA as well in terms of international exchanges, and highlight WFP's commitment to South-South collaboration, including experiences in multiple sectors with Bangladesh, the Philippines, the potential of looking forward to Thailand for an upcoming exchange, and these are in areas of fortified rice as well as school meals. Finally, in conclusion, I would like to note that WFP, as the Secretariat of the School Meals Coalition, of the Global School Meals Coalition, which has been joined by 98 countries currently, looks forward to continuing to work with Indonesia, including the Ministry of Health, to support the joining of the Global School Meals Coalition. Thank you very much for this event today, and we look forward to our continued partnership. Terima kasih banyak.
Terima kasih, Ibu Jennifer, and thank you, WFP. I would now like to invite from the Food and Agriculture Organization, Bapak Luke Schoenman.
Selamat sore. Thank you for the invitation for this meeting today. FAO has been working on health very much from the pandemic threats, zoonosis, and One Health perspective. That goes back to 2006. When avian influenza was a pandemic threat and Indonesia was heavily involved, and we worked also together not only with the animal health sector, but also with human health sector, Ministry of Health. Later on, also focusing on other diseases, notably rabies. We work together with Ministry of Health, both at the national and subnational level. Since 2015, we are working under the global health security, focusing on zoonosis, emerging infectious diseases, AMR, always a One Health approach. At the moment, we are working on global health security with 3 different ministries. Ministry of Health is an important partner for us, but we are mainly working together with the Ministry of Agriculture, Ministry of Environment and Forestry, and the coordinating ministry. As such, we feel that the Ministry of Health is an important ministry for us as a partner, and we are looking forward to work with the Ministry of Health under this One Health kind of approach over the coming years, probably also under the pandemic fund, if that is going to be awarded to Indonesia. So as such, we feel that Ministry of Health is an important partner for us under One Health, and as such, we are looking forward to working together with the Ministry of Health.
Thank you, Bapak Luke, and thank you, FAO. I would now like to invite Ibu Irene from PATH and then followed by FIND.
Selamat sore. Selamat sore Ibu Liza, selamat sore Pak Sekjen, selamat sore Pak Bonanza, dan juga selamat sore to all delegates, international NGOs, donors, all participants of this very important Indonesia Health Partners Meeting 2024. This is our second time to be invited into this very valuable meeting. So before I start with our commitment throughout the 2024 to 2027, I would like to share first what supports that we have been doing our best to support the Indonesia Ministry of Health to increase of course, the health system and services in Indonesia. In the past, we have conducted related to the HIV screening. We call it project, the community-based HIV screening, where we have a very valuable recommendations, including regarding about the reach out, about the linkage to the care and treatment services, as well through the studies, through the 3 studies we conducted. One of it is a very valuable regarding the willingness to pay of the oral fluid screening kits, and we have handed over all the deliverables to the Ministry of Health, represented by the Directorate Communicable Disease Control, and also other support that we had do our best was related to what we call the SOURCE project, where SOURCE is the strengthening oxygen utilization and respiratory care ecosystem, where far before the pandemic hits the globe, including Indonesia, we have partnered with Indonesia government, Indonesia Ministry of Health, through partnering with one of our reputable university in Indonesia, University of Gadjah Mada, as well with the one other faith-based organization, which is Muhammadiyah Disaster Medical Center, MDMC. In this support, we already handed over the deliverables. One is the roadmap of the oxygen production and as well distribution, the roadmap of the production distribution to assist the Indonesia government on define the policy, especially to face the related to the preparedness of emergency. And considering, and we are very grateful with the opportunity to support the Indonesia government in this matter is the Minister of Health. We express our interest to support more. Hopefully our support will be very significant. Therefore, we put it into the activities that we committed here. There are 4 key activities throughout the next 3 years. Why 3 years? It doesn't mean we want to work here for 3 years. No, we really hope at least from the next 3 years, our contribution will be even more significant. So the first activities, the previous slide first, please. The previous slide. Okay, let me read. Present it. So the 4 key activities is regarding the test to scale digital integrated cadre approach in Indonesia. This is related to the national program of the integrated primary healthcare. I will explain later in a bit detail about this. And also the second, sorry, the slides is too fast. Sorry, previous slide, please. Previous slide. Okay, previous slide, please. Previous slide. Previous slide. Previous, not previous. Okay, and the second activity is regarding advancing research and development of novel oral polio vaccines and OPV. And the third activity is strengthening the continuation of the source project, what we call the strengthening oxygen utilization and respiratory care ecosystem, where in our previous project, we are very grateful to announce that our significant support to the Indonesia government is on the development of the ASPAC. As we know, ASPAC is the National Digital on Health Equipment, where we partner with the PKMK University of Gadjah Mada. And from the work of this previous ASPAC project, we have agreed to support more. I will explain later a bit regarding our plan for the next support project. And the fourth activity is supporting cardiometabolic care through PHC. Actually, this based on the previous Indonesia Health Partners meeting last year, December last year in Bali, where our Minister Pak Budi presented the priorities expected from the development partners. So we accommodated that into our activity. And apart from those 4 commitments, we also would like to support through other 3 other supports, which are sustainable, still continuation of the source project, the sustainability scaling effective person-centered tuberculosis case finding strategies in Indonesia, and also develop training modules, tool strategies to build local capacity to improve routine immunization coverage rates. This one based on our discussion with our local partner as well with the Director of Immunization of MOH. And of course, we also would like to support regarding the health information system strengthening. And when we are talking about the integrated PHC, we have been started through a very intensive discussions with our Honorable DG, Ibu Maria Endang, and the team, as well with members of consortia, and I'm very glad to see other members of the consortia like Pak Triono from Tinghwell, Mbak Ati from CHAI also here. So from PATH, what we offer is 4 models. As we know, cadres in Indonesia in the past, there are many types of cadres. There are cadres malaria, cadres HIV, there are various cadres, while actually the persons are the same. What we call lulagi, you again. Only the uniform is different. The uniform of the cadre malaria area. Then the next day we'll use different uniform as the cadre of HIV, for example. So we are supporting the initiative, very good national initiative regarding the primary healthcare, where the first from our support is the integration of the primary healthcare through the 4 models, which is the synergetic and gender intentional work streams that divided into 4 work streams. So later on, the cadres, actually we have been started in Surabaya as designated locus from the DG, in Surabaya, Surabaya as the hyper-urban locus, and also Kerom in Papua, the remote and border area. Hopefully the result, the findings, the recommendation will be used in other parts of Indonesia that also have similar categories with these 2. And regarding the source, as I promised to share, what will we support? So because of the successful of the ASPAC and the Regional Maintenance Center from our previous ASPAC project, for this source, the strengthening oxygen utilization and respiratory care ecosystem, we will do through our partnership with our partner, the PKMK Universitas Gadjah Mada, want to develop the expansion of the ASPAC. Where the ASPAC of the KJSU is the cancer, heart, stroke, and uronephrology, and also the non-KJSU dashboard. And also we also would work on the support on the ASPAC dashboard to support oxygen-based services, which is quite very minimum in the past, and also the advocacy of the usage of the ASPAC. Thank you for the opportunity, Ibu Liza, and also thank you. Selamat sore.
Thank you, Ibu Irene. Thank you, Path. I'd now like to invite Ibu Siska Wiguno from FINE, and then followed by Tony Blair Institute.
Good afternoon, Ibu Lisa, Bapak Kunta, and Bapak Bona, and esteemed colleagues. Foundation for Innovative New Diagnostics, or FINE, is a global non-profit organization connecting countries and communities, funders, decision makers, healthcare providers, and developers to spur diagnostic innovation and make testing an integral part of sustainable, resilient health system. Since the signing of the MOU between the MOH and FINE in January 2023, FINE has been in close collaboration with the MOH to support the vision of Indonesia health transformation, especially on Pillar 1 of primary care, Pillar 3 of health system resilience, and Pillar 6 of health technology. Through the joint action plan, we seal the commitment through 5 areas of cooperation, namely strengthening access to diagnostics in Indonesia, technical assistance on local manufacturing of in vitro diagnostics, digital health, antimicrobial resistance, and health talent transformation. We are looking forward to continuing our support to the MOH and build partnership with other stakeholders to achieve health for all, as envisioned in the Golden Indonesia 2045. Thank you.
Thank you, Ibu Siska, and thank you, FINE. I'd now like to invite Mrs. Suhaila Hakim from the Tony Blair Institute.
Good evening, everyone. Your Excellencies, Bu Liza, Pak Kunta, Pak Setiaji, Pak Bona, and honorable guests. Thank you for having us today. Our country director, Ibu Suhaila, would like to send her apologies for not being here today. We deeply appreciate your warm welcome and the opportunity to be here. First and foremost, we'd like to congratulate you on convening the partners meeting, the establishment of the Donor Coordination Forum, and the publications of the National Health Master Plan. We are truly honored to be part of Indonesia's transformative health journey, and it has been a great pleasure to work hand in hand with the ministry teams under the leadership of Minister Budi, together with the esteemed Director Generals to drive the real impact and progress in the public health sector. Within a brief span of 2 years, TBI are delighted to share that we have been successfully working together across 7 directorates to realize the National Health Transformation Plan under Director Generals of Pharmakes, Kesmas, Yankes, BKPK, including with ROCOM, Pusdatin, and DTO under the remits of Secretary General. We have also collaborated with fellow health strategic partners such as World Bank, UK Embassy, FCDO, BMGF, USA CHISU, DFAT Prospera, and others. Looking ahead, we are excited to further deepen our relationship and contributions in public health ecosystem. Ladies and gentlemen, please allow me to briefly share with you the latest development of TBI partnership with Ministry of Health in the past 12 months and the impacts that we have accomplished together to date. Together with Pharmacus, we have devised strategies and policies to bolster national pharmaceutical and medical device resilience, addressing obstacles in medicine access, pricing, supply chain management, and fostering investment in R&D and manufacturing. We have collaborated with Directorate Generals of Yankes and Kesmas to improve the accessibility and quality of primary healthcare through Integrated Care Pathway, or ICP, and improving access to health services in remote, rural, and disadvantaged areas, or DTPK. TBI also supported Pusdatin and DTO, now GovTech Health, in the development of Digital Health Transformation Strategy 2025-2026 Blueprint. And in addition, we have also been facilitating transitions of DTO to INA Digital, the GovTech unit of Indonesia. TBI is also honored to have been a part of and witnessed the launch of Starlink in Bali and Aru Islands last month. In collaborations with Communication Bureau, or ROCOM, TBI have amplified the narrative of health transformations agenda of the Republic of Indonesia, engaging both international and local media outlets. Furthermore, the capacity building initiatives for healthcare professionals at state-owned hospitals in Indonesia is also a key support that we're going to provide, contributing to the Ministry of Health digitalization's agenda overall. Excellencies, it is within the Institute DNA to get things done. For future plan, TBI is looking forward to providing our technical support for the Ministry of Health in several areas with utmost importance. First, we will continue to power health services with digital and technology, focusing on data collections to inform policy development and health services delivery. The Digital Health Transformation Strategy Blueprint is poised to propel Indonesia to become the leading country in digital health transformation. And we are keen to explore and support the government of Indonesia to start devising its forward-looking strategy by bolstering its health services with artificial intelligence, bringing precision medicine and removing barriers from the past, such as chronic shortage of physicians, allowing faster screening and early treatment of diseases through telemedicine, all enabled by a simple smartphone. Second, support the strategic pathway for Indonesia Clinical Research Center, or INA-CRC, to enable early access to medicine and foster investment in health and life science industry. TBI is proud to partner with Ministry of Health from the idea conceptions of INA-CRC back in early 2023 and swiftly converted the idea into established agency in such short time. We believe that improving access to innovative medicine should be faced with strategy to translate the access to improving Indonesia's resilience. INA-CRC will improve access to biotechnology and also innovative medicine for Indonesian people. In November and December 2023, US FDA and UK NHS has approved CRISPR technology, a gene therapy for sickle cell disease for their patients. This is going to be our inspirations to enable INA-CRC to become the next agency to match that. Third, collaborate to mitigate the growing threats of climate change for population health. Climate change is becoming one of the biggest threats to global health in 21st century. Climate and health topic has been highlighted in high-level meetings, such as G7 in 2022. Recent COP also acknowledged the importance of health impact of climate change. And a month ago, WHO has published its General Program of Work 2025-2028, which prioritized climate and health. Since COP28 last year, TBI have put attention to addressing climate change and the impact for population well-being, which involve channeling finance and scaling technology in areas like clean energy, adopting food and health systems, and preserving and redeveloping natural carbon sinks, while at the same time ensuring the most vulnerable are protected. We are keen to support the Ministry of Health in crafting strategy and policy development to create climate-resilient health system, aligning with economic and social agendas, ensuring that climate action does not conflict with broader national health objectives. Much of this work needs to be led by national political leaders, putting in place plans and delivering policies and investments. And TBI is here to help you get things done. Thank you very much.
Thank you, Pak Willy. Thank you, TBI. As we are mindful of time, as well as a few more colleagues that would like to share their interventions, we ask that the next interventions keep with the 3-minute limit. I'd like to now invite from APLMA, Dr. Xavier Chan.
Hi, very good morning to all. My name is Xavier, and with the Asia Pacific Leaders Malaria Alliance, we appreciate the time that you have given us, and I'll make my remarks brief. I'd like to talk about 3 key areas. One is to share briefly the focus of the partnership that we have with the Ministry of Health. Second is to provide a quick update as to where malaria is in Indonesia and what needs to happen. And then the third is to call out some of the key next steps that we're looking forward to working closely with the Ministry of Health. The first one is that the goal of the partnership between the Asia Pacific Leaders Malaria Alliance is to really support Indonesia in its commitment towards elimination of malaria by 2030. And we do that through 3 key areas, one being technical advocacy and technical assistance. Second, to support cross-border collaborations, particularly with Timor-Leste and PNG. And thirdly, on resource mobilization. And we work very closely with the national program and partners like WHO, UNICEF, and also key NGOs like Dignitaries. The second is to, in some ways, call attention to where malaria is in Indonesia now, because not many might be aware that Indonesia today bears the 3rd highest burden of malaria cases in Asia Pacific, and it has indeed as well made remarkable progress in recent years. For some of us who might be also who have attended the World Malaria Day celebrations on Monday, we celebrated 17 new districts who have been certified malaria-free. And with that, 76% of all districts in Indonesia are now malaria-free. So what really remains, I think it's a persistent challenge in the eastern islands of Indonesia, Papua in particular, where more than 90% of the remaining cases remain. So in some ways, I think this is an opportunity to call upon all donors and health partners to jointly focus efforts to get the job done. Because we do know that bringing down malaria has immediate impact on reducing maternal deaths and stunting. We're working quite closely with UNICEF in particular, I think on strengthening some of the integrated approaches in that space with that approach. So lastly, I want to talk about and share with you 3 key areas or 3 key next steps. One is to highlight the fact that with the reduction of cases, Indonesia is going to be facing decline in donor funding, particularly from the Global Fund. So the point to make is that it then becomes important for the Ministry of Health and with partners to think about sustainability planning and donor transition, especially prevention of reintroduction once Indonesia achieves elimination. So in that regard, we're working quite closely with the Ministry of Health and partners to undertake resource mobilization towards malaria elimination, particularly to target contributions and opportunities to engage more meaningfully with private sector and the philanthropy sector. So, in terms of the donor office plan that was revealed this morning, we're really interested to find out more how best to leverage that and to be aligned with existing donor plans. And with that regard as well, with the support from the ministry, there is a plan to undertake a partner consultation and somewhat of a soft launch of the concept of a malaria-specific financing facility in September this year. So I just wanted to highlight that this is coming, and we're looking forward to extend more conversations with all partners. The second point that I just wanted to also highlight for your attention here is that over the last few months, we've been working closely with the ministry as well to bring partners together to develop a national roadmap on malaria elimination and prevention of reintroduction. So, and the plan here is also to in fact launch in September as well. So again, just something to highlight for all to be aware of. We'd like to be able to share more information and, obviously to invite all partners as well to support the ministry in launching this national roadmap. The last point which I would like to share here is really about the importance of leadership commitment, and with that regard, I'm happy to also announce that the 9th Asia Pacific Leaders Summit on Malaria Elimination, which is a head of state meeting, will be happening in Indonesia next year. So we're looking forward to supporting Indonesia as the host country and host government for that ministerial forum. And therefore, with that, let me hand over the time, and thanks again for the opportunity to speak. As a new organization of sorts, this is the first time that we have been invited to this Health Partners Forum, and we look forward to definitely working more closely with the ministry and also all partners in this room. Thank you so much.
Thank you, Pak Xavier and APLMA. Next, I would like to invite from the Fleming Fund, Dr. Emil Agustiono.
Terima kasih, Ibu. Good evening, everyone. The Fleming Fund has supported the government of Indonesia since 2020. The grant works closely with the ministry, the National Antimicrobial Resistant Laboratory Network, and One Health Programming. This is to support the implementation of the National Action Plan on antimicrobial resistance containment. The grant primarily supports the health system transformation under pillars 2, 3, and 6. The grant works under the guidance of the Director General of Health Service, Ashar Jaya, to strengthen the laboratory-based surveillance through the national reference laboratories and the hospital network for AMR surveillance in support of Pillar 2 and 3 of the health system transformation. This has included surveillance network strengthening through the renovation of the national reference laboratories and procurement of higher value analyzers, ultra-low temperature freezers, and other critical equipment for bacteriology, biosafety, and biosecurity, consumables and reagents, standards and guidelines for AMR containment. The grant has worked with the ministry counterparts and Indonesian experts to design and deliver over 20 high-caliber training courses to over 1,500 trainees and technical experts in human health. The grant has provided a specialized technical assistance and mentoring from the surveillance system design through laboratory to data management, analytic, and reporting, including whole genome sequencing and bioinformatics. Recognizing that antimicrobial resistance can develop in other sectors and spread across sector boundaries, the grant's collaborative work with the Ministry of Health also extends to One Health coordination and joint decision-making with other ministries and laboratory counterparts. Aligned with this, the Fleming Fund's fellowship and counter-grant program support the development of AMR specialized technical and policy-making skills and collaboration within and across sectors. In Phase 2, 2024-2026, the grant will continue to support sustainable laboratory-based surveillance, data analytic, and data use. This will include ongoing support to the existing AMR laboratory network and inclusion in additional 4 hospitals. That's in Ulin, Banjarmasin, Sorong, West Papua, Husin in Palembang, and Adam Malik in Medan Hospital. Yeah. This will include ongoing support to existing MR network inclusion organization for hospital, while continuing to support the laboratory capacity across Indonesian referral laboratory system. The second phase will further emphasize surveillance, data quality, and application and policy making at national and institutional level. This will include supporting inclusion of AMR data management, analysis, and reporting capabilities with existing digital health system. Finally, we are enormously proud of work with the Ministry of Health on AMR containment, particularly AMR surveillance, to strengthen and upskill specialized workforce in human healthcare and cross One Health sector. This is resulting in better healthcare outcomes. Thank you very much.
Thank you, Pak Emil. Thank you, Fleming Fund. We have about 20 minutes left and about 13 speakers to go. We invite and welcome those that are already on the list and perhaps others that would like to share their text or messages by writing. I would now like to invite from area Dr. Takuma Kato, followed by CDC and then Vitamin Angels.
Thank you very much, Ibu Lisa Pakbona, for inviting us today. This is a great opportunity for us to learn how we can work for Indonesia in line with the Indonesian priority. I appreciate the strong leadership and initiative on Ministry of Health to strengthen the health system in Indonesia as well as the ASEAN. AREA's mission is to provide study and evidence those are useful for policymakers in ASEAN. In addition to that, we are trying to liaise our study with other development partners to deliver direct support. In terms with the healthcare unit, we have mainly focused on aging topics and access and delivery issues in healthcare system. Particularly, we have worked with WHO and other international partners on diagnostics, especially WHO Essential Diagnostic List since 2021. If I'm not mistaken, Indonesia has also worked for improving diagnostics, not only for Indonesia, but also for the ASEAN. We do appreciate your great work, and also we hope to support Indonesia's initiatives on diagnostics in ASEAN, such as situation analysis with our experience. Besides that, we also anticipate to keep the collaboration on aging topics as we worked together last year. AREA has been working providing longitudinal data for elderly people of Philippines and Vietnam, and have been working with OECD to promote active aging in the region. I hope that the study will be helpful and we can collaborate further in Indonesia. And also, we are quite open to any healthcare topics, particularly regional common issues. I hope to keep discussing with Ministry of Health for further collaboration. Once again, thank you very much for inviting us today. Based on what I learned today, AREA will keep working with Indonesia as much as we can to strengthen the regional health system. Thank you very much.
Thank you, Pak Takuma, and thank you, AREA. I would now like to invite CDC.
Thank you, Ibu Lisa. On behalf of our leadership, we send their regards. They cannot attend here. I'd just like to share the support that CDC has been provided to the Ministry of Health. The CDC has a long-standing cooperation with the Ministry of Health regarding the health transformation that previously presented. We mostly works on the health system resilience. And then our focus area is on the workforce development, disease surveillance, laboratory strengthening, and emergency preparedness. And then our leadership share that we look forward future cooperation with the Ministry of Health, where our priority will align between both of us. Thank you.
Thank you, Ibu Mia Ulfa from CDC. I now invite Bapak Ote Santika from Vitamin Angels.
Thank you very much. Vitamin Angels is a public health nonprofit organization based on the US. So we are interested to support Minister of Health in maternal nutrition area, especially in the micronutrient supplementation program as a replacement of the iron folic acid for pregnant women. So our support could be from provision of the MMS supply, technical assistance, and also capacity building for both health worker and also for the local manufacturer to ensure that MMS can be produced locally. Thank you very much.
Thank you very much, Bapak Ote. Ladies and gentlemen, as you can see, we also have present in the room representatives from partners from the private sector and civil society. Our ministry is welcome to and acknowledges that the health sector requires a multi-sectoral and multifaceted approach. Running the health sector by the government alone would not be sufficient. We definitely need to partner with other governments, international organizations, civil society, and private sector. I'd like to invite Bapak Martin Hutagalung from Illumina, and then followed by Prodia.
Selamat siang, Ibu Lisa. Thank you for inviting Illumina to take part in today's partners meeting. Illumina is a DNA sequencing, genomic sequencing technology company. Genomic screening was mentioned a couple of times today by donors, by partner countries, as an area where they would like to support Indonesia in. Well, our company makes genomic screening possible. We've been in Indonesia for the past 13 years, working closely with the Ministry of Health, public health laboratories, universities, and others. We applaud MOH's health transformation program, in particular in the area of precision medicine, with the establishment of BGSI. We are proud of our partnership with BGSI, where for the past 2 years we have worked closely to help build capacity, build capability, including with DTO, and to further formalize our relationship. Illumina signed an MOU earlier this year with Pak Kunta to help build a genomics engine in Indonesia. We look forward to strengthening many years. Thank you.
Thank you, Pak Martin. And thank you, Illumina. I would now like to invite Ibu Indri Wulandari from Prodia, then followed by Komli Labkesmas.
Yeah, thank you, Ibu Lisa. I'm from PT Prodia Widya Husada Tbk. We are private laboratory chain in Indonesia, and right now we have 152 branches in Indonesia. We are very interested to support in health ministry program, particularly for prevention. Today, Prodia can offer more than 3,000 kind of clinical laboratory tests in routine testing, hormone, vitamin, allergy, autoimmune, microbiology, and genomic testing. So we can contribute to health ministry program, for example, for newborn screening, monitoring diabetes, and genomic testing. In genomic testing, we have varieties of genomic testing, not only for diagnostic and treatment, but also for prediction. We run the test in Indonesia and using server based in Indonesia and using Indonesia database. Hopefully we can contribute in, for example, BGSI program, and to be referral lab, not only for healthcare players in Indonesia, but also for Southeast Asia players in genomic testing. In digital, we have application, and we call it UB Prodia, and that has some feature for prevention and monitoring health program. Hopefully we can contribute to increasing awareness health by digital. Think that's all from me. Thank you for kind attention.
Thank you, Ibu Indri. Thank you, Prodia. I would now like to invite Pak Siswanto from Komli Labkesmas.
Yeah, thank you, Bu Lisa. So my name is Siswanto. I am from the Public Health Laboratory Expert Committee. So as you all aware that one of the transformation in public health service is the establishment of public health laboratory across the country. So as a laboratory system to support disease screening and surveillance in our public health laboratory system, we have 5 tiers. First is tier 1 at the Puskesmas level for simple case detection and screening, and tier 2 at the district level, tier 3 at provincial level, tier 4 at regional level to coordinate and take leadership for a number of provincial laboratory. And the last is tier 5 at national public health laboratory. So with regard of this new system of public health laboratory, I have the view that for the completion of laboratory device, reagent, and then also surveillance system, including early warning system, as well as capacity building for the laboratory human resource, in my view, it would be great if we are obtaining the support from our development partner, like WHO and then CDC and other development partner. I thank you.
Thank you, Pak Siswanto from Komli Labkesmas. I would now like to invite Ibu Ira Sulistyo from the Indonesian Care for Cancer Kids Foundation.
Thank you. Thank you so much. Selamat sore, good evening to everybody. I'm Ira Sulistyo. I will speak on behalf of YKAKI, Indonesian Care for Cancer Kids Foundations. And it is a parents' organization. We established in 2006, and we now have 6 branches in Indonesia, especially for shelter as well as for hospital schooling. We have helped almost about 7,000 children with cancer all over Indonesia, but unfortunately, 40% of them died due to late stage of cancer or late diagnosis. So in these opportunities, I would like to ask the participants here, Ibu Lisa, maybe I have read in the recap grant for 2025, it is mentioned for the non-communicable disease that you have already put some amount there, is also for medicines for cancer, because it is important that we have to have many medicine that is been like for quite some time. And I understand that this is here also have the representative from India, and we all know that India is the best producer of many medicine produced in India. So hopefully you can add on that. Last but not least, of course, I would highly appreciate the effort from the Indonesian Minister of Health that have us as a grassroots organizations and many other organizations also involved here and listen to the plan to increase the health system in Indonesia. I really appreciate that. And of course, thanks to all the support for many countries and many NGOs who has worked together hand in hand for the better health system in Indonesia. Thank you so much.
Thank you, Ibu Ira, and we acknowledge the long-standing support by YKI to patients in Indonesia. I would now like to invite from Nura Health Indonesia, Ibu Dia Setiawati.
Thank you very much for the invitations and opportunity from the Ministry of Health to contribute to these roundtable discussions. Unfortunately, our country director is not able to attend our meeting today, and he sent his apologies. And please allow me to introduce our work at Nura Health on his behalf and introduce our commitment to support Indonesia's plan as outlined in Indonesia Health Sector Master Plan presented today. Nura Health was founded in 2014 with a vision to have a world where patients and their caregiver are a core component of healthcare delivery and family member training is a standard of care. We do this through improving outcomes and strengthening health system by equipping family caregivers with the skill they need to care for their loved one. In the past 10 years, our approach has been proven effective in improving patient outcomes, reducing hospital readmissions, and enhancing overall healthcare experience, both in India and Bangladesh. To extend these missions in Indonesia, since 2023, Nura Health established Yayasan Nura Health Indonesia to further develop and implement its missions to meet specific needs and context of the health system in Indonesia, fostering sustainable and effective healthcare solutions. Our commitment is further strengthened by our collaborations with the Ministry of Health through a 5 years MOU until 2029 that establish our support through our Care Companion program. This year, we are starting this support in maternal and newborn care, but are looking forward to collaborating in other condition areas in the futures, including aligning our plan with the priorities of the governments of Indonesia. Since the launch of the CCP programs last year, we have been on a journey of learning, reflection, and expansions. From September 2023 to date, we have trained 16,703 caregivers, bringing our total to more than 5,000 patients. We are looking forward to strengthening these collaborations with more agencies across Indonesia in the future under our current MOU with the Ministry of Health. We are also looking for strengthening family and caregiver support through digital innovations, which we are currently discussions with the DTO office of the Ministry of Health. We are excited to continue discussions with you and other fellow partners in this panel to have more fruitful and meaningful family caregiver support in the futures, including aligning our missions with the overall plan to improve national and global outcomes, and to ensure that family caregiving becomes one of the standards of care. We believe that everyone is a caregiver, including all of us in the room. Thank you again for the opportunity to introduce our organizations and convey our messages, and we look forward to further collaborations with the Minister of Health and other partners in the room in the futures. Thank you.
Thank you from Neura Health Indonesia. I would now like to invite Nova Nordis, Pak Fikriansyah.
Terima kasih banyak Ibu Lisa. Over here, Ibu, on the left side. I'll be here. And a very good afternoon, Pak Kunta, Pak Setiaji, Pak Bona, and all the ambassadors as well as distinguished guests. Allow me to quickly introduce myself. My name is Fikri from Novo Nordisk, Indonesia. Novo Nordisk is one of the pharma company that based in Denmark. We are very much focusing on serious chronic diseases, especially on diabetes and obesity. And listening to everyone's insights and the presentation before, I would like to acknowledge the remarkable efforts that the Ministry of Health in Indonesia have been doing. All of our partners' commitment to transforming health system has been nothing short of extraordinary. All the dedication and hard work brought about significant improvements that positively impacted the lives of countless individuals. Novo Nordisk is committed to support the implementation of 6 pillars of health system transformation under the G2G partnership between the Ministry of Health of Indonesia and Denmark. We are appointed as the executing agency as implementing primary care directorate, including on the improving the awareness, capacity building, access to care, as well as providing real-world evidence for the better evidence-based decision on policy. Our core focus including bring healthcare closer to patients. One of the projects that we can probably proudly share today in this opportunity is on affordability project. One of the projects that we implemented as a pilot project to remove access barrier for vulnerable people in rural primary care. We had cooperations with the West Java Province Health District Offices, Perkeni, PEDI, as well as Ministry of Health. We screened over than 270,000 people in rural area from 46 puskesmas, and we trained 191 healthcare professionals, including the healthcare cadres, community healthcare workers. Hopefully this project can be one of the best example, best practice that can be implemented in nationwide. And we also want to share with everyone in this forum that since 2019, Novo Nordisk and UNICEF also partnered to contribute to preventing childhood overweight and obesity. And we are proudly to share that 2023 we start the partnership here in Indonesia. So hopefully that the second phase of this partnership can also be collaborated together with the Ministry of Health. And we would like to continue working together in framework of public-private partnership with the Ministry of Health, and hopefully the RIBK can also be focused on diabetes and obesity, as it is also one of the mother of diseases that can continue to more complicated diseases. Thank you, Ibu Lisa.
Thank you, Novo Nordisk. I would now like to invite Ibu Fitri from Incamaris Associates, the implementing partner of the Bill and Melinda Gates Foundation.
Ya, baik. Selamat sore. Terima kasih sebelumnya Ibu Lisa. Thank you for inviting us, and it's an honor for us to be here today. Our director, Ibu Widya, sent an apologize that cannot attend to the meeting today. So we are from Incamaris and Associate, is one of the partners of BMGF in Indonesia, and we are committed to support the health system transformation in Indonesia through the strategic collaboration and impactful communication. So the BMGF itself has been giving support to various partners, including ThinkWell, SID, PET, and others development partners to support the 6 pillars of health transformation system in Indonesia. For Incamaris itself have been working closely with the BKPK to translate the analysis result from such of partners like HSO and other development partners into the policy draft. And secondly, for the immunization, we recognize that the critical need to boost the public confidence in immunization program. So we are actively supporting the Ministry of Health in developing and implementing a communication strategy to increasing the confidence level of the public regarding the immunization. So presently, right now, we develop for the playbook for the immunization FAQ that involve some of the expertise and the Director of Immunization Management to craft the message that easier to understand to the community and address their concerns. And Incomar is also giving assistance to creating the forums and communication platform that focus on cervical cancer and also for the TB vaccine. So by bringing together all the stakeholders from the different sector, we aim to foster a collaborative environment where innovative solution can be developed by implementing effectively. So thank you once again for the opportunity in this event, and we look forward to continue our collaboration with Ministry of Health to build a healthy future for all. Thank you, Ibu Lisa.
Thank you, Ibu Fitri. On behalf of the Gates Foundation, I would now like to invite Ibu Ria from Yayasan Pena Bulu, then followed by Stop TB Partnership.
So thank you very much, Ibu Lisa, Minister of Health team, and it is our pleasure to meet everyone in the room. I'm Ria. Allow me to speak on behalf of Pena Bulu Foundations. Pena Bulu Foundation is a civil society organization working on the social and health issues. We are committed to have a meaningful collaborations with the Ministry of Health and other health partners in Indonesia. So our work on health areas on TB project in collaborations with the Stop TB Partnership Indonesia, supporting the Disease Control and Prevention Directorate. With the funding of Global Fund, we manage active case funding, refer patients to care and treatment, and providing psychosocial support for TB patients. We're also supporting about 7,500 TB patient household contact to get TB prevention therapy. As of today, with the great collaborations with cadre on the ground, we are able to refer about 440,000 TB suspects to the TB diagnostic services in about 30 provinces, 190 districts in Indonesia. And starting this year, 2024, we're collaborating with the Health Promotions Directorate, trusted to manage USAID funding as implementing partner for Integrasi project, an integrated primary health care as a first pillar of the health transformations. We're working in 20 districts and cities of Sumatra Barat and Banten. We are delighted to know the Ministry of Health future visions and expected to have a better collaborations between community and the government at the national and the sub-national level. Thank you.
Thank you, Ibu Ria from Yayasan Pena Bulu. I would now like to invite Ibu Nurul Luntungan from Stop TB Partnership Indonesia.
Thank you, Ibu Liza and Pak Kunta. My name is Nurul Luntungan. I'm from Stop TB Partnership Indonesia. We are an Indonesian NGO established in 2018, focusing to support the government of Indonesia to eliminate TB with strong partnership and multisectoral approach. Our organization, supported by Medco Foundation, Stop TB Partnership, APCASO, and TB Alliance, is also the principal recipient for the Global Fund TB Community, as previously mentioned by our colleague from Pena Bulu. Stop TB Partnership Indonesia, together with Stop TB Partnership, is also committed to support the government of Indonesia in the work of TB diplomacy and advocacy in all levels at global, national, and subnational level. We have assisted the government of Indonesia during the G20 side events on TB, UN high-level meeting on TB in 2023. We also support the work with coordinating Ministry of Human Empowerment and Culture in monitoring and evaluating the implementation of the presidential regulation on tuberculosis. And we work together with the Ministry of Health to advocate the social protection program for TB patients to the Ministry of Social Affairs. At the subnational level, we are also supporting the advocacy efforts of the community and district health office to strengthen local resource mobilizations needed to strengthen their TB responses. Stop TB Partnership Indonesia, along with our partners, applaud the leadership from the government of Indonesia to end TB. We are committed to continue our support to the government of Indonesia for strengthening the implementation of Indonesia's multi-sectoral TB policy and advocacy, also in TB service delivery, community mobilization, public campaign, and resource mobilization to strengthen TB response under the 6 pillars of health system transformation. Thank you.
Thank you, Ibu Nurul, and thank you, Stop TB Partnership. I now invite Ibu Mita Rosalina from PT Roche Indonesia.
Halo, selamat sore. Terima kasih, Bu Lisa. I think first of all, on behalf of Ross, I would like to say thank you so much for inviting us. This is my privilege to be here, to be invited and attended this meeting partner. Actually, again, congratulations and big applause to MOH for having a donor office. I think it's really shown that commitment from MOH will help partner like us to get clarity, transparency, and simplicity for doing partnership work with the Ministry of Health. And just a bit information about Ross Indonesia. Actually, we are the in vitro diagnostic company that have been operated in Indonesia more than 50 years and globally established for more than 100 years. And aligned with the health transformation to expand the promotive and preventive action, actually Ross Diagnostic is very committed to contribute our knowledge, expertise, and competency in innovative solution that beneficial for the healthcare ecosystem, including the society. And here, Ross also committed in the laboratorium strengthening program, and it's already shown that during the COVID period with Ross helping the testing implementation more than 3,000 tests, and also did capacity building for the healthcare professional and also laborant more than 10,000 training, and also the capacity building for the high medical value testing. And recently, we also very happy and proud that we can contribute in the development of the NCCE plan, National Cervical Cancer Elimination Plan. And we are, Ross, now ready to enhance and formalize our contribution by having a MOU with the Ministry of Health, with focusing on the national program of activities such as a screening program for HPV DNA, pilot study, and also the HIV viral testing, then diabetes mellitus, which aim to accelerate the achievement target, which increasing the impact of community and society with the holistic approach on screening implementation, pilot study, capacity building, and also disease awareness. And I do hope by seeing having the strengthening collaboration among the stakeholders in order to accelerate achievement of healthier Indonesia, Ross also can commit and also can contribute in this collaborative effort. I think last but not least, thank you so much for having me in this meeting. Thank you.
Thank you, Ibu Mita and PT Roche Indonesia. Last but certainly not least on my list would be Ibu Brian Sri Prahastuti from the Indonesian President's Office. Silakan, Ibu.
Yeah. Thank you, Chair. Good afternoon. And also for Pak Kunta, the General Secretary from Ministry of Health, and also Pak Setiaji, and also good afternoon for all ladies and gentlemen, the partner of Government of Indonesia who are participating for this Indonesia Health Partners meeting. As introduced, my name is Brian. I'm the Senior Advisor for Health, Women Empowerment, and Child Protection of the Executive Office of the President. And my apology because I came late for this meeting and I left behind the presentation of Minister of Health. But following the statement from partner who are participating for this meeting. And from our side, actually the Executive Office of the President, of course, support the Ministry of Health and all effort on the transformation of the health, particularly in relevance to the vision of the government of Indonesia toward gold generation of 2045. as you may know, that Indonesia is entering the long-term development plan 2025-2045, and 2045 is the important momentum for us because at that year we will be 100 years after our independence in 17 August of 1945. And our national long-term development plan 2025-2045 clearly stated that our goals for Indonesia Sehat or Health Indonesia is an outcome of social transformation for Indonesia Emas. And thus meaning that the building a strong and responsive health sector, health system, I mean the health system, strong and responsive health system will be the mean for the social transformation to ensure all Indonesian people will have a long life and healthy. And then the stunting is less than 5%, and also eliminated tuberculosis and leprosy. And if I'm not miscalculation, we will have a target of life expectation age of 80 years old. If we are not miscalculated, if there is a transformation, there is no acceleration, we will very difficult to achieve the target. So it's very clear that the transformation of health is very, very important for Indonesia. And I believe more technical strategic will be designed by the new elected president and vice president, but support for all partners, both national and international, is needed to ensure that Indonesia can successful to achieve our health development plan. And also, we believe that the successful target for Indonesia will contribute a lot in the global strategies, because I see that many of you also come from international agency. So looking at how full this room and variety of school of work of the international, of the agency, of the partner who come in this meeting show that number of partner has been involved and support the Ministry of Health and still continue, and maybe some partner will is planning to be involved, further involved. So we believe that the Ministry of Health will be more stronger and also more confidence to do their agenda of the health transformation. That's all from me, and thank you again, Chair.
Thank you, Ibu Brian, and thank you to Kantor Staff Presiden for all your leadership and support to our ministry and the health sector. Ladies and gentlemen, distinguished guests, I'd like to thank you all for all your highlights, comments, and commitments that you've shared. We welcome any comments and notes from those that may want to share this in writing to us. We've noted all your constructive points, inputs, and ideas to further advance our collaboration. Our appreciation goes to the recognition expressed during the roundtable discussion on the establishment of the Donor's Office at the Ministry of Health. We look forward to work with you through that, and I don't think I can do justice by trying to capture the richness of our discussion and the points you've mentioned. However, I can assure that those inputs and ideas will be followed up and addressed in the next Indonesia Health Partners meetings, if not before. With that, let's move to the next session. Thank you.
Thank you very much, Ibu Liza, for helping us navigate this wonderful deliberation. Excellencies, delegates, ladies and gentlemen, and now please welcome the special dance performance of Nusantara Cintan Dia.
Hello, good afternoon, ladies and gentlemen. How are you today? It's great. Okay, once again, I would like to give us a big round of applause to our performance, traditional dance from Indonesia. All right, in this special occasion, let me introduce myself. My name is Galuh Pandu, as your master of ceremony for the rest of this afternoon. And now, we are moving to an exciting part of our meeting, the appreciation session. Once again, please give a round of applause to warming up for this special afternoon. In this our moment, this is a moment to celebrate the hard work and dedication of those who have made significant impacts in our health sector. And this session will also provide an excellent opportunity for further engagement and the exchange of ideas. And we appreciate your dedication for joining us for the entire program. All right, ladies and gentlemen, distinguished guests, as we come together this far to recognize and celebrate the invaluable contributions of our partners and embassies who have played a pivotal role in the journey of transforming health in Indonesia. We have the privilege of acknowledging an remarkable contribution to the 6 pillars of health transformation. Already on the screen before you, you will see the 6 pillars that form the foundation of our transformative journey in healthcare. And these pillars are the cornerstones of our efforts to create a healthier future for all Indonesians. Allow me to introduce the partners who have profoundly contributing in each of the pillars. Firstly, Pillar 1, the primary care transformation. And we have the Global Fund, the USAID, Gavi, the Vaccine Alliance, UNDP, the UNICEF, the World Bank, the Australian Department of Affairs and Trade, the World Health Organization, the Asian Development Bank, the government of the United Arab Emirates, the UNFPA, the Fleming Fund, IHPM, the MSF, Nutrition International, the Global Alliance for Improved Nutrition, the Japan International Cooperation Agency, the Clinton Health Access Initiative, the Fred Hollows Foundation, the Union Health, and the World Food Program. Okay, the next is Pillar 2, secondary care transformation. And we have the USAID, the Clinton Health Access Initiative, the Fred Hollows Foundation, the government of Japan, the Islamic Development Bank, the Asian Development Bank, and the last but not least, the government of United Arab Emirates. Pillar 3, Health System Resilience Transformation, we have the USAID, Gavi, the Vaccine Alliance, the UNDP, the UNICEF, the World Health Organization, the government of Japan, the World Bank, the Australian Department of Affairs and Trade, the Japan International Cooperation Agency, the Japan Asian Integration Fund, Center for Disease Control and Prevention, and the Fleming Fund. Pillar 4, Health Financing Transformation. We have the USAID, the World Health Organization, the World Bank, the Australian Department of Affairs and Trade, and the Think Well Institute. In Pillar 5, the Health Talent Transformation, we have the World Bank, the Australian Department of Affairs and Trade, the World Health Organization. And then lastly, in the Pillar 6, the health technology transformation, we have the USAID, the UNDP, the UNICEF, the World Health Organization, the World Bank, the Australian Department of Affairs and Trade, the United States Trade and Development Agency, the Asian Development Bank, and the Global Fund. Once again, we are profoundly grateful for your contribution and commitment, and we look forward to the continued journey of transformation and innovation. For the next, ladies and gentlemen, I would like to call the next group of partners to join us to the stage, the representative from the Global Fund. Once again, I would like kindly to call the next group partner to join us on the stage, the representative from the Global Fund. And then the next, the representative from the U.S. Agency for International Development, USAID. United Nations Children Fund, and then the representative of Gavi Defection Alliance, the World Health Organization, the Australian Department of Affairs and Trade, the World Bank, United Nations Population and Fund, United Nations Development Program, Japan International Cooperation Agency, the Fleming Fund, the Clinton Health Access Initiative, United States Trade and Development Agency, the Think Well Institute, the Nutrition International, and Midesong Zong Frontier, MMS. Okay, for the next group, I would like to invite the representative of the Global Alliance for Improved Nutrition, Fred Hollow Foundation, the Asian Development Bank, Center for Disease Control and Prevention, the Union Health, the Japan Asian Integration Fund, the Islamic Development Bank, the Mammoth Foundation, the MGI Technology, the World Food Program, the BGI Genomics, the Vital Strategies, the AT Scale, the Asian Infrastructure Investment Bank, WhatsApp, and last but not least, Google. Alright, the next I would like to kindly invite Bapak Purna Wibawa Dasa Nugraha and Bapak Sutiaji to present the appreciation plaques on the stage. Ladies and gentlemen, could we give a big round of applause? the partners that made a significant pivotal role in our health sector in Indonesia. Once again, give your best smile in this afternoon. 1, 2, 3. All right, thank you very much. Please give big round of applause. This is our partners that has been made a significant role in our health sector in Indonesia. Thank you very much for your commitment. Thank you for your dedication and your contribution in health sector in Indonesia. You may return to the seats. Thank you very much. And we hope this collaboration going into our next successful journey ahead. Well, ladies and gentlemen, distinguished guests, we now going to move forward to the next segment of our appreciation session, honoring the distinguished embassies that have played a pivotal role in supporting our health transformation initiatives. This is a moment to recognize your invaluable contribution and unwavering support. Now, I'm delighted to invite the following ambassador and representative to come up and join us to the stage. His Excellency Daniel Blockert, Ambassador of Sweden to Indonesia. His Excellency Sandeep Chakraborty, Ambassador of India to Indonesia. Representative from embassies of Australia, Kingdom of Saudi Arabia, United Kingdom, South Korea, Denmark, the Islamic Republic of Iran, Canada, Netherlands, Japan, United States of America, Kuwait, Qatar, France, Germany, United Arab Emirates, Singapore, China, Brazil, and Switzerland. All right, to present these appreciations, we are honored to welcome Ibu Sharifah Liza Munira, the Director General for Health Policy Agency, Ministry of Health, the Republic of Indonesia. position. Let's do a photo group. Well, you ready? Okay. 2 step to the left. Okay. Again, step to the left. Okay, it's enough. Ready? On my count, 1, 2, 3. Give your best smile once again. 1, 2, 3. Thank you very much. Please give a big round of applause. Thank you so much for distinguished embassy. Ibu Liza Sharifah, please keep remain on the stage. Ibu Sharifah, please keep remain on the stage. Okay, we have a wrap-up session and then Ibu Sharifah Liza Munira will say something to all of you, distinguished guests, ladies and gentlemen, to wrap up this session.
Excellency Ambassadors. Excellency Ambassadors, esteemed health development partners, distinguished participants, ladies and gentlemen, what an insightful day of discussions we've just had, and I hope you've also enjoyed the performances and sessions we had today. I believe a lot of networking and side meetings also took place. Now today we had 234 participants from 20 embassies and 119 international health development partners. How remarkable. I'd like to take this opportunity to express my appreciation to all of you for your contribution and active participation in making this second International Health Partners meeting a success. Excellencies, ladies and gentlemen, the second Indonesia Health Partners meeting has deliberated on a number of strategic agenda in health. 1, we've looked at best practices in delivering health innovations grounded on collaborative approaches between the Ministry of Health and all of you, our international development partners. From 2021 to 2025, our partnership has reached more than 13.9 billion rupiah to support the 6 pillars of Indonesia's health transformation agenda. We are here today to celebrate our achievements in reaching 38 provinces and 514 districts in Indonesia through our bilateral partnerships, grants, and loan agreements that has been supported by all of you. Due to the commitment of our partners, we have contributed significantly to TB reduction, improved HIV/AIDS care, and malaria elimination, followed by improvements in delivering nutrition and immunization programs. 2, we've shared and hopefully gained a better understanding of both your organization's priorities and those of Indonesia's health transformation agenda, so that moving forward, we can help reach the overarching goal of Indonesia Emas 2045 or Golden Indonesia 2045. On behalf of the Ministry of Health, I would like to express my appreciation for the commitment of each of our international health development partners. I am honored to meet you in person and understand your organization's priorities. I would also like to invite development partners to scale up their support for other innovative programs as set forth in the grants proposal for 2025 to further continue the health transformation agenda. Excellencies, ladies and gentlemen, in 2024, the Ministry of Health will continue driving our best efforts on the 6 pillars of health transformation. While we have witnessed that Pillar 1, primary care transformation, has received much support, we also have observed that more support is needed in Pillar 4, health financing transformation, and Pillar 5, health talent transformation. I would also like to promote the unpublished 7th pillar of the health transformation. This is to support the internal bureaucracy of the Ministry of Health, so transforming this to support innovation and sustainability of the 6 pillars. This transformation, the 7th pillar, aims to not only reform the people, but also our working culture to produce a new and improved Ministry of Health. Excellencies, ladies and gentlemen, I believe you will all agree with me of the value of good networks and close collaboration. So moving forward, the Indonesia Ministry of Health is keen, with the support of the health development partners here, to accelerate the achievement of Indonesia's health transformation and really work towards bringing the future here, future of improved health and well-being for the Indonesian community. We look forward to collaborate and further coordinate with you and have discussions after this event in the networking dinner and appreciation night we have prepared. I wish you an enjoyable night and conversations. Thank you.
Thank you very much, Ibu Sharifah Liza Munira, the Director General for Health Policy Agency, Ministry of Health, Republic of Indonesia. Thank you, Ibu, for those powerful and encouraging remarks. All right, ladies and gentlemen, we are come to an end for this afternoon. On behalf of the committee, we would like to express our utmost gratitude to all of you for making this event successful. Please forgive us for any shortcomings. Before we close our sessions today, I have a few important announcements. We will be hosting a networking dinner immediately following the session. This is a wonderful opportunity to continue our conversations, forge new connections, and celebrate our achievement together. We kindly invite everyone to join us at the foyer of Birawa Hall. And this special occasion, I would like to say thank you very much for the embassies, the partners that have made a really great contribution, really great support for health sector in Indonesia. Please give a big round of applause to all of us. And we have to come and then for Indonesia Health Partners Meeting for this afternoon. As we close our today's event, I am confident that cooperation we have cultivated today will bring us closer to our shared goals. Your collaboration is crucial, and I look forward to seeing the progress we will achieve together. Thank you once again for your presence and engagement. Have a great afternoon. Wassalamualaikum warahmatullahi wabarakatuh. Enjoy the dinner.
you.